Good to go, sir.
Okay, so good evening to all our dear students. So today, finally, NEET PG 2024, after a few postponements and a preponement, has come to a close. And yes, now you can rest assured that the exam is over. Okay, no more postponements and preponements. So basically, this will be a session by some of the DocTutorials faculties to have a quick go through the questions that were asked in the NEET PG exam. And as you all know, the exam was conducted in 2 sessions. And as I speak now, all our faculties are collecting questions of the paper 2 as well. So as of now, we have got relatively a better idea of paper 1. And once we have more questions of paper 2, we will be discussing that as well. So to begin this session at the outset, let me just tell all my dear students, especially starting with paper 1. Okay, we had a discussion among all the faculties to analyze how paper 1 was and the difficulty level was. So basically, if you look at this paper 1 to begin with, I feel that overall the difficulty level was moderate to tough. So importantly, if you compare with the last year NEET PG, I felt that this is a slight notch tougher, the paper 1. Okay. So the initial inputs regarding paper 2 is that the questions were relatively tougher compared to paper 1, but we'll give you more insights onto that once more questions are clear. Okay. Now, as I said, compared to last year, another interesting point to be noted is that there were a lot of image-based questions, much more than you would expect in a conventional NEET PG paper. So this is an important message to all the students who are preparing for the next NEET PG as well. More number of image-based questions. But again, something I would like to highlight is that you will understand as some of our faculties go through the recall questions that there were a lot of integrated questions. So questions in which, you will see, say, myself and say Vandana ma'am or Nilesh Raj sir, we'll be discussing a few common questions because there were many integrated questions. Probably this is why we thought that, at least a year back in DocTutorials, we had introduced a lot of integrated MCQ discussion videos because that was the line in which the exam was going, a lot of integration. So if you look at, we had a conversation with many students who gave the exam, and what we understood was that students who learned the topics conceptually, had a better exam. What actually happened is that some of the students who relied only on shortcut material, revision courses alone, actually faced the heat. Because when you want to answer such integrated questions, you should have a solid knowledge backup. Yes, these revision sessions might actually help you towards the end, but many students made a big mistake of relying on shortcut materials, and that actually costed them very badly in the exam. There were many students who actually said that, sir, we were confused with 2 options. And what is the reason for that? Your understanding of that topic was not proper. Now, this is what happens when you just learn one-liner stuff and go to the exam. The examiner will test you with such conceptual knowledge-based questions. And at least for the students who are preparing for the next exam, please make sure that your preparation is rock solid and you need to practice such integrated MCQs as well. Were there questions from previous year questions and previous year topics? Yes, answer is yes, because, as far as my subject goes, the questions that were asked relatively were based on previous year topics, but the manner in which the question was asked actually tested your base knowledge as well. Okay. So let me just tell you that whatever we are going to do now is not going to be a detailed recall session. We will be coming up with individual subject-wise detailed recall sessions once we get a complete framework of the question, because as you all know, the answers to certain questions can change by, say, a word or so. So once we get a complete recall, we'll be giving you the most authentic recall as well by the subject-wise recall videos as well that we'll be coming up with the, in the DocTutorials YouTube channel as well. So please stay tuned to the channel as well. Now, we have got some of our faculties, and some of them could not join because, today being a Sunday, for faculties who are teaching, even a Sunday is a working day. So that's why. So we'll have a quick fire discussion. So to begin with, we'll have Sandeep Sharma sir, the pediatrics faculty of DocTutorials. So Sandeep sir, hope you're doing good. And finally, NEET PG is over. So how was pediatrics, sir, for the exam, and your take on that and the questions that were asked?
Thank you so much, Dr. Rahul. A very good evening to all the students who are listening to this discussion. I am Dr. Sandeep Sharma, pediatric faculty at DocTutorials, and it's my privilege to connect with all of you. Yes, even I'm relieved that finally NEET PG is done. Like, even till last moment, we were not sure that whether the exam will be held or not, or any last minute thing will crop up. So the one small little thing we should all be happy about, I don't know, happy or sad, I don't know about it, but at least the exam is done. Good or bad, the exam is done. The paper was done in 2 sessions. We have all got, see, the recalls, the initial reactions are still pouring in. From what we can make out overall, as per my resources, as per my feedback which I've got from the students, paper 1 was about moderate level. Paper 2 was about 5 to 10% tougher overall compared to paper number 1. But again, the recall session, as Dr. Rahul rightly said, detailed recall, we will be doing subject wise, where we will be covering full question, the most authentic explanation and the question possible. That is going to obviously take time. But here we are going to talk about how the overall pattern was, and we'll be talking individually about our subjects. So coming to pediatrics, first of all, let me share the screen as well. I have collected a few things which I want to share with all of you. And you would notice that the pediatrics in this paper, like any other exam, was again of a solvable level. So I hope this is visible to all of you. So the paper NEET PG 24, the overall impression of pediatrics was, it was as expected. As expected means the way we had planned. Generally, pediatrics is of a solvable nature, and this time also the pediatrics was solvable nature. Average, see, paper 2, more recalls yet to be yet to come. So majorly it is based upon paper 1 and a few inputs from paper 2. So average 12 to 15 questions were asked from pediatrics, which is the usual weightage that you get every year. 9 to 10 questions were core pediatrics. Core pediatric means it cannot be any other subject. It is only pediatrics. Remaining were integrated. For example, there were questions from inborn errors of metabolism. There were questions from pathology. There were questions in malignancy where a child was involved, but there was integration with path and medicine as well. And then there were overlap with other subjects. 40% questions in pediatrics. This is something very important. 40% questions were direct or indirect repeats. Getting them wrong will throw you out of the bus. It is as simple as that, because the competition is so high. So repeat questions were something that you had to be exactly precisely thorough with. Remaining 60% questions, most of them were solvable. Many image-based questions were asked. This time, NEET PG exam was full of image-based questions. So only one-liners are not going to work out. Even the image-based questions many times had a proper clinical stem given to that, followed by the image. And there were less one-liners. If you start seeing from 2019 and go all the way to 2024, you will find a common pattern. Every year, the number of one-liners is reducing. Even the one-liners which were there, they were a part of a clinical thing, something clinically relevant. General and systemic pediatrics was more compared to neonatology. This is a trend that we have seen, that INI-CET places more emphasis on neonatology and systemic, whereas NEET PG people put more emphasis on general and systemic pediatrics. And if you had properly prepared, a child is always innocent. A child is also very, very, smiling. and more than 90% score you would have got if you had properly prepared. So what were the questions? I will quickly go through them without wasting any time so that the other faculty can also take over. Uh, which of the following is harmful or should not be used in a normal baby after delivery? Four options were given. Eye care using a wet swab. See, many times the eyes will be sticky and secretions will be attached. So you will take a sterile swab, dip it in sterile saline, and wipe from medial to lateral side. It can be done if it is needed. Skin to skin contact with mother. This is kangaroo mother care. Even if KMC is not being given, skin to skin contact between mother and baby is always recommended. Immediately breastfeeding. Breastfeeding started as soon as possible. Fourth option was bathing baby with warm water.
Sir,
Common
can
sense
you
was
make it full screen?
child has just been
Full
born.
screen.
You try
Full
to
screen.
bathe the baby. Obviously, baby is going to go into hypothermia. So, answer to this question was what should not be done? Bathing baby with warm water. Again, a disclaimer, this is based upon the recall. If the options change, if the question stem changes, the answer can also change. As I said before, detailed recall we will be doing in some time. So, this was a fresh question. If you have attended the clinics, if you have attended a delivery, if you have done your internship well, you would know the answer to this question even without reading. Having said that, this is something that we have discussed in the detailed videos on DocTutorials as well. Moving to the second question, this is a topic which is always asked. 3 days before the exam, I had put up a reel saying the topics you must not miss. This was mentioned there if you remember. So 6-week-old baby had repeated vomitings after feed. Ultrasound image was showing. There were two variations of this question. One student said, "Sir, ultrasound was showing antral nipple sign." Another said, "Sir, it was showing target sign." What is the diagnosis? Diagnosis in either of the ways: congenital hypertrophic pyloric stenosis, also called as idiopathic hypertrophic pyloric stenosis. Expected question. Third question. This was an image-based question, which is a repeat question from NEET PG 2022, which itself was a repeat from INI CET 2020, the second half of the exam, which itself was a repeat from about 2016, if I remember correctly, AIMS entrance exam. So fourth time this image has been repeated. अगर इसको गलत किया है, so my dear friends, you have created a big mistake. Don't worry, whatever has been done, but silly mistakes like these should be avoided. This was a photograph showing exostrophy of the bladder. It has been asked innumerable times already, right? So fourth time, I would say, directly or indirectly, this question was repeated. One direct repeat from NEET PG itself. Then this again question was a repeat question from the 2022 exam. So there were two pediatric repeats from NEET PG 2022. So there was a typical crumpled tissue paper appearance along with CNS involvement, anemia, and hepatosplenomegaly. So this was a patient of Gaucher's disease that you had to diagnose. So again, I don't need to talk about the details. Detailed recall we will be doing very shortly. Then this was a question where they had asked, what is the investigation of choice in a child with posterior urethral valve? Posterior urethral valve, in my videos, I have always taught you, in my classes also, I always say, investigation of choice is always MCU. Yes, ultrasound is done. Ultrasound shows a keyhole sign, but it is never the investigation of choice. And it is a very common mistake we see people do even in TNDs and grand tests. So MCU or VCUG, whatever was mentioned, would be the correct answer here. Then there was a question asked on celiac sprue in a child. So which antibodies are positive? This is what I have been told. Some people said, sir, reverse pucha tha. So it is up to you what has been asked. From what I've heard is this question was there in both paper 1 and paper 2. So celiac sprue, also called as celiac disease, investigation of choice for screening is anti-tissue transglutaminase. We always do a combination of total serum IgA along with TTG. If that is not available, only then we go for anti-endomycin antibody. I hope you remember the funda that if an option is saying only TTG alone, another option is saying TTG plus IgA, you have to mark TTG plus IgA. If such a option was not there, TTG can be marked. If they had simply asked TTG positive, what is the diagnosis? Answer would be very simple. It will be celiac disease. Then there was an image-based question regarding the growth curves or Scammons curves. Some people said, sir, identify karna tha. Some said, sir, you had to match the column. So 4 types of growths are there. There is somatic growth, which is sigmoid shaped, brain growth, which shows a plateau after 3 to 4 years, lymphoid growth with maximum peak occurring 4 to 8 years of age, and gonadal growth, which takes up around 10 to 12 years once puberty comes. So it was an easy question. It was I would not say a direct repeat, indirect repeat question, but if you have been solving INICT and FMG past questions, this question has been there in the older papers. So it was not NEET PG repeat, but it was an indirect repeat from the other exams, right? And in our workbooks, we have discussed about it as well. And then case scenario of infant with vomiting after feeding, Benedict's test was positive and non-glucose reducing substance was present. So the diagnosis was galactosemia. If they had asked about the enzyme deficiency, it is typically caused by galactose 1-phosphate uridyl transferase enzyme deficiency. I hope you know that galactosemia can be theoretically produced by three enzyme deficiencies: galactokinase, epimerase, and transferase. But it is the transferase deficiency, also called as GALT enzyme, G-A-L-T enzyme, which causes classic galactosemia, is life-threatening. And this is the patient who will present when the child drinks milk. There will be a toxic reaction causing jaundice, hepatomegaly, transaminitis, and the patient developing cataract in the eye. And E. coli sepsis is very common. Again, we have discussed this multiple times. So it was a solvable question again. Then there were topics or recalls where the details are yet to come. So there was a drug of choice on ADHD. Rules are very simple. If they ask in general, the answer will be methylphenidate. If they say ADHD in a cardiovascular patient, the answer will become atomoxetine. Both the scenarios again, uh, easy if this was indeed the question which had been asked. There was another question where karyotype along with case scenario was mentioned, and karyotype was showing X chromosome single, no Y chromosome. So Turner syndrome was the likely diagnosis. Then they had asked question on timing of surgery in cleft lip and cleft palate. Now there are two types of views here. Some people are saying, sir, cleft lip pucha. Some said cleft palate pucha. From what I can make out is probably in one of the papers they had asked cleft lips timing of surgery. Another paper they had asked timing of surgery in cleft palate. Cleft lip surgery is generally done around 3 months of age, and the procedure is called as modified Millard's rotation advancement technique. It is a staged procedure. A repeat procedure needs to be done later as well. So first surgery for cleft lip is done around 3 months of age. If they ask cleft palate surgery is palatoplasty. It must be done before the child celebrates first birthday. So generally 8 to 12 months or 9 to 12 months, by 1 year of age, it should be done. So it will depend upon kya pucha hai and what are the options given to you. So slightly tricky, but if you have prepared well, you should be able to answer it. Then again, weight for height image-based question was asked. Uh, Image is not available, so I cannot discuss it right now. I have asked some of the students to share that. So weight for height, if it is low, we call it as wasting. That indicates acute malnutrition. Now remember the funda that if it is between 0 and -2 standard deviation, the child does not have malnutrition. If it is between -2 to -3, the child has moderate acute malnutrition. If it is below -3, that is severe acute malnutrition. So it will all come down to what was given to you. If you remember the funda, I've discussed similar examples innumerable times in my classes. They are there in the video and they are there in the QRP session as well. Talking about QRP, before I finish off, uh, and a small announcement from my end. I hope all of you get selected. But for those students who will be sitting in the NEET PG 2025 exam, DocTutorials is going to come out with its own unique program called as DocTutorial Live for NEET PG 25. We are going to connect with all of you and teach you all the things in a live manner. At the same time, you will be getting access to all the DocTutorials recorded lectures, as well as all the QBanks, test series, and the QRPs that will be available to you. So watch out for the announcement in a few days from now. And for those who have given the NEET PG 25 exam, I do hope that you and me, we don't see each other, at least for learning pediatrics for NEET PG exam. And then there was another question on HGPRT deficiency, where Lesch-Nahan syndrome was the answer. Some more recalls are coming in, but like there was a question on leukemias in children, and it was a case scenario, but they had mentioned about the prognosis in the child. Remember the funda that translocation 922 BCR-ABL, if it is there in adult, that is indicative of CML, and that has a good prognosis, but in children, it has a poor prognosis. In one of the papers, this was the question they had indirectly asked you. So these are some of the recalls. Detailed recall will be coming soon, and wishing you all the very best. Chota mota mistake if you have made, don't worry. Everyone makes mistakes. What matters is if you have read well and if you have given your best shot, nature will be kind to you. It was a easy looking paper. It was not an easy paper, paper one as well as paper two. So have hope and stay positive. Pray to God that God helps you, and keep smiling. Take care of your health as well. Over to you, Dr. Rahul.
Thank you so much, Sandeep sir, for that precise session wherein you have discussed most of the currently available recall questions that you have got, and definitely students will be looking forwards to the detailed discussion videos as well. So moving on to the next speaker, we have got Dr. Rajidavan sir, our ENT faculty of DocTutorials. So sir is also joining. So I think most of the ENT questions, from what I understand from the students, were from his notes. And also there is one very useful video in the DocTutorials YouTube channel where sir has very concisely covered ENT. I think a few questions have come from that as well. So Sandeep, Dhawan sir, over to you for discussing
Yes,
the key questions, sir.
yes, yes. Thank you very much, Rahul sir, and good evening, everyone. Uh, Very early impression of the examination. It was a moderate paper, not an easy paper, first of all. And paper in the evening, what we are able to say as of now, overall, all subjects combined, has been a little bit, like I would say, challenge level is a little higher, but uh, exact information will be coming maybe tomorrow or day after. So after collecting all the subject, questions. Regarding ENT, the mixture of questions have come from the morning and evening session. In year, as usual, they have asked the otosclerosis, which Dr. Raulaji was also saying that in one of our tests, he was asking me about that the Carhart's notch and otosclerosis. Again, they were kind enough to ask that. The second question was the nerve supply of the pinna, which is again a very favorite topic. As we discussed multiple time in the class, also five nerves supply it. So they were the section of nerves they asked that which particular set of nerves supply the pinna. Again, it was very, like I would say, expected question. Third question was about the CSOM with the perforation in the tympanic membrane. Obviously, you have to understand it's a conductive hearing loss, but they asked about tuning fork findings. The choices were like Rene positive, false Rene negative, and all that. So it was a very, I would say, if you know the tuning fork test, you know conductive hearing loss is there. So there'll be a, Rene negative, but in a true manner. True Rene negative will be there. Understandable. One question of cochlear implant, post-implant radiology has been asked, but as of now, the picture is not clear. Probably they were marking the arrow at the electrode, which I think will be getting confirmed picture in next 1 or 2 days. That then we'll get the proper subject-based recall. But the fourth topic was asked was cochlear implant. So in the ear, as of now, what I could understand, the external ear nerve supply, the pinna nerve supply, otosclerosis with the audiogram again, and the tuning fork in the form of conductive hearing loss perforation, and the cochlear implant radiology picture. First time they gave the radiology picture of cochlear implant. Let's see what was the real picture. Um, then out of the, again, the foreign bodies are favorite topic for the future aspirants also they should know. Every time esophageal foreign body X-ray was there again. And there's a disc battery question again. So disc battery is double ring shadow or double edge. Again, INSCT repeat question. And then they ask about the, age-old favorite topic of angiofibroma. Angiofibroma, there was the best investigation asked, and we know it's contrasting and CT, which gives Hall-Miller sign over there. And uh, again, a very doable question. A singer is unable to sing properly. The means a poor quality of voice. Which muscle is not working properly, or the muscle affected is cricothyroid, which is the main tensor of vocal cord, and that gives the poor quality of voice. So as of now, sir, this is the question, like set of questions we have been getting from the students. However, the proper recall we will take time. The idea of connecting today with everyone was to sort of get an overview of the paper, and in the subsequent coming days we'll be having the proper recall of the session 1, session 2. But my message for all the students of NEET PG, you have done your best. Honestly, after the postponement and the preponement and the postponement and the preponement and the postponement, finally you appeared in the exam, and I think you need to take it easy now. It's absolutely craziest NEET PG I've ever seen. I could never have imagined that NEET PG in COVID time was not that badly affected, but this was the most crazy. Even I was keeping my fingers crossed last night that I hope we don't get message at 8:30 p.m. the exam is cancelled or postponed due to some other reason. I'm glad, as Sandeep sir said, that at least it happened. There's sense of relief over there. My dear friends, please spend time with your family, friends who have been waiting for your attention. And you have been going through multiple, like mental phases of escalation of preparation, then downfall. We'll be definitely doing, recall. But as of now, if you see, the paper was moderate, actually, not easy paper. So this will go in favor of those people who have prepared well, and this will be giving you the edge of preparation, and that will be reflecting in your rank also. So I think let's have the sense of pride for ourselves that we have put our best foot forward. We played the best shot during this exam, and let's expect a good rank. And please connect to us in the subsequent days again for the subject wise recall as well. Once again, my sincerest advice to everyone to take it easy for a couple of days and relax. Thank you very much, everyone. Thank you, Dr. Rajiv. Over to you.
Thank you so much, sir, for going through the ENT questions. And as sir said, a few expected questions and not much surprises in ENT. But as sir said, it's all about understanding the topics very conceptually, and that is what was tested. So from here, we'll move on to PSM discussion. So we'll have Rajasi madam here. So madam, how was PSM this time? So madam will take you through the PSM questions. So we'll have
Yes,
Dr. Rajasi madam here to discuss the PSM questions.
Hello, good evening. I'm just trying to connect. Please give me a sec. Trying to share the screen. Are you able to see the screen?
Yes, ma'am. I can see your screen.
Okay. Yeah. Thank you, Rahul sir. So as far as PSM is concerned, I'm so happy that it was very easy. Okay, honestly, it was very easy. I could recollect around 25 questions, of which only one question students found little bit difficult. It is not like it wasn't discussed, but it was not given as a very important question. All the rest of the 22, 23 questions were taken as the most important question, and that was thoroughly discussed. So in that sense, PSM was very, very easy. Another point which I found something different from what we have seen in the earlier NEET PG exams, where this time in PSM, a lot of statistics questions were asked. Usually that comes in INI. I always tell students that when it comes to INI exam, statistics plays a very important role. But this time, a lot of statistics questions were asked, but they were very easy. So without wasting time, in another 5 minutes, let me go through all the questions. So one question was from paired t-test, before, after. So students, majority of students, almost everyone said they could answer it correctly. Then there was second question, what is the full form of JSSK? It is Janri Shishu Suraksha Karyakram, which everybody could write, I guess. And this was everything about, the services, everything was discussed, but the question was very, very simple. What is the full form? And the third question was very much expected, which I discussed even the previous day of the exam. That is the logo and the services given by NLEP. This is the logo of National Leprosy Eradication Program. So that fingertip, everything we have discussed, and students were very happy that they could write it. And then this was asked. This is a repeat question, and I hope everybody could write it. It is Kata thermometer. So this was there, and another expected question. Then this image was given. Okay, so in the numerator, exact image was given. In the numerator, maternal deaths were given, and in the denominator, women in the reproductive age group were given. Few wrote it as maternal mortality ratio, but the answer was maternal mortality rate. But majority got it right. But maternal mortality ratio is something that we always ask. They usually don't ask about maternal mortality rate. But I always tell students how to differentiate between maternal mortality ratio and maternal mortality rate. And I hope majority could write it correctly. So this was another image-based question. Then this food plate was given, and the question is, which was the food which is rich in thiamine? This picture was shared by one of my students, so I guess this would have been the correct. I mean, he said he is not sure whether this was the exact picture. Anyway, this is what I got. And the answer was rice. Okay, the food which is rich in thiamine. Then this image-based question was given and you were asked to denote or write which among this graph is showing birth rate. So this green is showing birth rate, whereas the red is showing death rate. Very, very simple actually. Then in the slot 2, right now I'm talking about slot 1. In slot 2, they have asked the different stages, to write different stages in the correct order. I'll come to that. 8th question was again from statistics. You were given some numbers and you were asked to find out median. Median, of course, it's a primary. I always tell students, this is a question that you can expect in your school. How to find out median, the middle value. There was one question from chi-square test. Then another question. This is the question that I have received. Different medicines were selected randomly from various strata, like, the medicines were divided into those which were derived from plant, those which were derived from animals, and those which were derived from minerals. And they randomly selected these medicines from various strata. And the question was, which is the sampling technique? The sampling technique is obviously stratified random sampling. Then 11th question was, what are the components in HDI? Something interesting is, HDI and PQLI, I always say you have to remember as kill and ill, the components. And the components of HDI was asked in slot 1 and the components of PQLI was asked in slot 2. So HDI, it is slot 1, which is kill, and that means knowledge, income, life expectancy at birth. And I always tell students to remember the components in PQLI as ill, which came in the second paper, that is IMR, longevity, and again literacy. So I hope everybody got it right. Then question number 12 was about the treatment of mixed infection in malaria. And it was kind of tricky, but this is a question. On day 2, for a 50 kg patient, which all drugs will you give in the correct dosage? And this is the answer. I'm just going to the answer. Answer was, according to the question that I've received, it was option A. And the option A was artesunate 50 mg, 4 tabs, and primaquine 2.5 mg, 6 tabs. This was choice A, according to what I have received, to my knowledge. Then there was a picture of sandfly, I think, and they have to identify it as sandfly. Then farmer with calf muscle tenderness, headache, and conjunctival redness, which is the disease, was another question, which of course I have discussed, as you have to remember RRR. Okay, whenever you see rice field, that means farmer, or rain or rats, whenever you see any of this in the question, always think about leptospirosis. So it was the third R which came, which is farmer and rice field. So that is leptospirosis. Then this question was there to write in the order about the disaster management cycle. So starting with response phase, first one, recovery phase, third, mitigation phase, and fourth is preparation phase, which I'm sure everybody would have wrote. And then question number 16 was IUD insertion. When will you do? I couldn't receive all the options, but I'm just showing you these are the timings of IUD. And if you're watching this now or, after some time, you can choose which is the correct answer from the option, because I haven't received the options yet. Then question this was one question which was kind of tricky. Which among the following shows maximum iceberg phenomenon? We know that rabies and tetanus will not show iceberg phenomenon, whereas chickenpox and influenza will show iceberg phenomenon. Which among this will show maximum? The answer would be influenza. So here the answer is influenza. Influenza is the correct answer. Okay. Some said the question was like, if you do a screening, which will give you more yield? Again, the answer is influenza. One of this was the question. Then in slot 2, the question was to write the stages of demographic cycle, which I'm showing you right here, and I'm sure you know it. So let me not waste my time on it. This was the only question that students said, were kind of confusing and which was not very much expected, but I have discussed this. What is longevity dividend? I haven't received all the options, but the option was interventions reducing risk factor to prolong life. That was the correct answer. But I couldn't get all the options. Then in slot 2, you were asked to calculate maternal mortality ratio. See, ratio came in slot 2, whereas rate came in slot 1. And they said it was very, very simple. Then IMR calculation was there, very much expected. And this picture, this was an image-based question. This was given, and the question was, this girl with bag is denoting which disease, or it's a logo of which disease? This is, she is Sapna. See, she is Sapna. And Sapna is for leprosy. You know that, right? Okay, then there was a question about early neonatal mortality calculation. Total number of live births given, stillbirth given, infants who died between 0 to 7 years were given, and you know how to calculate it. The number of deaths in 0 to 7 divided by total number of live births, you will get early neonatal death. And then a question from PQLI regarding the components, that is A. So these were the questions, and PSM was very easy. That is the general feedback that I have received from students. So around 24 questions I could really collect till now, because it was, we didn't get that much of time. But as I get more questions, I'll be sharing it. Thank you very much, sir.
Thank you so much, ma'am, for that recall of PSM questions. And from here, we'll move on to microbiology quickly by Dr. Sonu Panwar, sir, a very experienced faculty. And I suppose most of the questions that have come are from sir's notes. So Sonu, sir, please join the session and please have a quick go through the microbiology questions, sir.
Yes, sir. Thank you so much, sir. So, am I the co-host? Yeah. Am I audible, sir?
Yes, sir. You're audible and visible.
Okay. So, as sir have also told that the paper was moderate and it was not easy, not very tough. And as usual, the microbiology is somewhat straightforward, some in the integrated form as expected, as they're moving towards the next pattern and all. So I'll be having telling you some of the straightforward questions which have come, and the later on we'll discuss up with the proper pictures and all that particular one. So without wasting much of a time of yours, because you must have undergone a lot of things. Now you must be enjoying also, but slight bit you listen to me. So there was a question regarding the egg of Enterobius vermicularis, and you know that is having a plano-convex stuff. And this particular one, Enterobius vermicularis, it undergoes autoinfection. I suppose the question was regarding the egg only. They have given the image of the egg of it, which is plano-convex, looks like a D. Besides this, in the later half, in the part 2, there was a question regarding the strongyloids stercoralis, in which the HIV positivity was given up. And they have asked up regarding the ovoviviparous nature of strongyloids stercoralis. And as ma'am have told, there was a question regarding the leptospirosis also, and the basic hint regarding that was conjunctival suffusion, along with the fever, along with the myalgia, and as ma'am told, triple R, rat, rice, and rain. Okay, so there was a question, traditional one, regarding the Thea-Martin media or modified neocogar, which is being used for gonococci. Another one was there regarding gram-negative cocci, which is capsulated, and that I suppose was regarding the meningococci. And after you listen up to this, please write up in the comment section that what was the exact one, so that I can also, for the final recall, can give you the best of the answers, because as sir have told, that one particular hint can change the full question. Fine. There was a question regarding the blood culture, and the budding E cells were seen. So that was regarding the Candida albicans. Histoplasmosis picture was being given up. There's a history of going to the USA, because that is also termed as OU disease, Arizona disease. So that was endemic mycosis there. So histoplasmosis is having what? It is having the E cells, budding E cells within the macrophages. I suppose that was the picture given up in this case of histoplasmosis. Regarding the nocardia, there was there, and in the nocardia, they have given up a gram-positive filamentous bacteria, which is involved up in causing up sinuses in the lower limbs. So obviously, they're talking about what? Actinomycetoma. And actinomycetoma is done by what, guys? Actinomycetoma is done by nocardia as well as this particular actinomyces. Okay, that is the bacterial cause of mycetoma. So this was there. Another straightforward from my notes. Blastomycosis, figure of 8 appearance, and HIV positivity, I suppose, was given up. You can add upon to that particular one that what was exactly there. Coccidioidomycosis, that is coccidioides immitis, that associates with a disease termed as what? Desert rheumatism. So desert rheumatism and San Joaquin fever, they associates with this dimorphic fungal disease, coccidioidomycosis, and the causative organism is coccidioides immitis. So this was also there in the notes. So that particular thing proves that the dimorphic fungi they were asked, and 4 to 5 questions they were asked from that particular one. Another repeat was there in the microbiology regarding the parvovirus, and as I've told up, a mnemonic for this, apne ho gaye parai, after having a slap. So that was there. P, that is pure red cell aplasia, that is being done by this parvovirus, which is what? A single standard DNA virus, and that is non-enveloped. Now, in the part 2, like in the second shift, there was a question regarding the chronic hepatitis B, not the exact option I could get up. I suppose there was IgG and THPC, more than 6 months, HBsAg positivity, that is also termed as chronic hepatitis B, along with they are telling like HBeAg was positive. So that means active replicating phase was still there. So it was a chronic active hepatitis, what they want to ask. You can tell me in the proper options regarding that. There was a question regarding the Nipah virus, and what was exactly given, that is not known. It was regarding the picture what they have given up, or they have given up like regarding the fruit bats and all. So I got to know that there was a question regarding the Nipah virus also. Now there was a controversy regarding a UTI question, that Staph saprophyticus is there in a sexually active female, does the UTI, and the count was found to be just 10 to the power 4 or more than 10 to the power 4. We know significant bacteria is what? More than 10 to the power 5. But in that question, I suppose it was also written that the burning micturition is present. So I've already told up in the notes and the lectures also that burning micturition is symptom and signs. So if that is present with 10 to the power 4 count, that is termed as UTI. So I suppose that will be UTI itself if the options are correctly given up. Okay. O157H7, that is enterohemorrhagic E. coli. You know, O is one, H is houch. Okay, O is one, H is houch. And this particular H is also termed as what? The flagellar antigen. And I suppose that was asked that what is H? H is houch in the Greek, and it is also termed as what? Flagellar antigen. Is it fine? Rotavirus pick was there, and you know rotavirus is what? Like wheel with spoke. That is the appearance in the electron microscopy of the rotavirus, and that I suppose there was in the second shift. This particular question was there. Another one is regarding the sandfly, the scientific name, that is Phlebotomus argentipus. Kalazar, I suppose there was a case scenario given up, hepatosplenomegaly, and Bihar history, hyperpigmentation. So, and they asked about the vector. The vector, obviously, you know, is what? Sandfly. Okay. There was a question regarding the multiplex PCR, nested PCR, or RT-PCR. That I could not able to get proper. What was the exact question? You can tell me in the comment section that what was the exact question regarding the multiplex PCR one. That I suppose if it is regarding some panel and all, so obviously the panels, like there is a respiratory panel, there is a meningitis panel in the PCR. So that will be based on multiplex. So might be the answer is multiplex, but don't know the exact options. So I can't comment up that what is the exact answer of it. Now, another repeat is regarding the C5 to C9 complement deficiency. C5 to C9 is termed as MAC, that is membrane attack complex. And if it is absent, what happens? Recurrent Neisseria infections. Okay, so it's a repeat, that is twice and thrice already asked up. And again, it is being asked up. C5 to C9 complement deficiency leads to what? Recurrent Neisseria infections. Okay. There was a criteria which was previously used for the bacterial vaginosis. Nowadays, we use AMSELS, but Nugent's criteria was asked, and Nugent's criteria was also there in the notes itself. So that is for the Gardnerella vaginalis. You know the bacterial vaginosis is done by what? Gardnerella vaginalis. Okay. Other than this, I suppose there was something regarding the congenital toxoplasmosis in which they have written up regarding the hydrocephalus, that is macrocephaly, along with that, chorioretinitis and all. Okay. And the favorite, which I tell every time that it might be asked of because it is a sort of a thing which they tend to ask from the Vibrio, that is Vibrio parahemolyticus. Okay. It was a repeated question of FMG exam. It came in the NEET PG also. So this suggests the importance that what is there in the FMG will be there in the NEET PG also, might be. And this was there. And Vibrio parahemolyticus, it leads to what? It leads to seafood poisoning. How much percent halophilic? 7% halophilic. After eating of what? Contaminated oysters. Okay. And which phenomena was asked? Kanagawa phenomena. And what is Kanagawa phenomena? Enhanced beta hemolysis on a particular media that is termed as Vagat-Suma agar. So this time they have asked up Kanagawa phenomena, and I am just telling up next time it will be on which particular agar. The answer is Vagat-Suma agar. Is it fine? And what is Vagat-Suma agar? A high salt content agar. This was there. There was an immunology question regarding the interleukin-8 that helps in neutrophil chemoattractant stuff. The clear options of endothrix was not able to get for that. What was the options? Because endothrix is a disease which is being done by TVS. That is tonsillins, violatium, and Sean-Lenny. But exact option I could not able to get what was regarding this particular question. Okay. So these are the various ones which I was having and which was told up by the students itself that this came and that came. And with the microbiology interrelation, you can solve up around easily in this paper also, and you must be knowing also 30 to 40 questions easily. So that is what is the core importance of this particular subject. And very best of luck from my side for the results of yours. And I suppose you will all pass with flying colors in this particular one and get great ranks. So let's get back to the Dr. Rahul, and he will tell up for the another one to discuss. Okay. And I will be coming up with a detailed version of this particular one, the proper pictures later on. So thank you so much.
Yeah, thank you so much, sir. And you've given a beautiful overview of the microbiology questions that were asked. So I'll now take you quickly through the medicine questions. See, first of all, let me tell you that medicine, I think for paper 1 especially, which majority of the questions that I've got are from paper 1. I felt that majority are integrated questions, which you can link with other subjects. So I just quickly take you through the questions. I'm not at all going for a detailed discussion video. As I said, we'll be coming up with individual subject-wise discussion videos. So that will soon come up. Meanwhile, somebody has also asked regarding the DocTutorials live batch that is starting up. So see, regarding the live batch, it is going to be an online live batch. So what we are doing this time in DocTutorials is already we have got DocTutorials app where we have got the recorded lectures. Then we have got 3 face-to-face centers in Hyderabad, the Calicut and Trivandrum, 3 offline centers. So we are now starting up with the online lectures, online live batch as well, wherein all the faculties who are taking lectures in the DocTutorials in the app, the recorded lectures. So these faculties are going to take a live batch for you. So if you ask me, what does this course actually mean? What is the difference from the recorded lectures alone? See, if you're somebody who is looking for discipline, okay, you're looking for discipline, you need a timetable, you need a schedule, and you want us to guide you to have that handhold feeling. So that means you are the ideal person for the live batch. Because in the live batch, we'll be giving you a proper structured schedule, and you can attend the classes. And something that is going to make this course very unique is that we'll be giving you workbooks as well, which will reach you before the class, so that during the class, you will have a very interactive session and you can add the notes to the workbook. So your learning will be a lot easier and you can memorize easily as well. So from September, we are going to start off with the live batch of the DocTutorials. At the same time, I also want to remind you of the offline batches that we have got at Hyderabad, Calicut, and Trivandrum. So depending on what you are more comfortable with, you can join. Now, quickly taking you through the medicine questions. Well, see, it all starts with any basic ECG question. There has to be an ECG-based question. So this time, you had a match the following type of question with images or ECGs of atrial fibrillation, atrial flutter, ventricular tachycardia, and paroxysmal supraventricular tachycardia being given, and you were asked to match. Another ECG-based question was regarding a chronic kidney disease patient with tall peak T waves, and obviously the electrolyte abnormality associated was asked, hyperkalemia. Another question from cardiology was that of a clinical scenario of constrictive pericarditis. Again, what I understand from students is that they had stressed on the JVP characteristic as well, which again we have discussed. Another question from cardiology was the all-time favorite, repeated multiple times, cardiomyopathy. Cardiomyopathies are an important topic. You cannot go to an exam hall without learning that topic. And if you've got to learn one topic in that huge topic of cardiomyopathies, it has to be hypertrophic cardiomyopathy. So a clinical scenario of a patient with a sudden cardiac death, and they had given a histopathology image as well. So again, it was suggestive of hypertrophic cardiomyopathy. In the detailed recall video session, I'll be posting the images as well. Then there was a question based on a clinical scenario of acute rheumatic fever. A scenario of acute rheumatic fever was given. So where the patient had presented with arthritis, elevated markers of ESR and CRP. And from what I understand from the students, it was regarding an 18-year-old patient. And it was also associated with fever. The rheumatoid factor was negative. So the answer is going to be acute rheumatic fever. And then coming to neurology. So from neurology side, the questions that were asked, number one, I think a very simple basic question on a Brodmann area lesion, Brodmann area 22 lesion, producing a receptive aphasia, which is the Wernicke's aphasia. And then again, another all-time favorite, subarachnoid hemorrhage. Usually they do ask clinical scenario-based questions. This time they have integrated with radiology. So patient with sudden onset thunderclap headache, and I think bleeding in the fissures of the brain. It is subarachnoid hemorrhage. The CT scan was given. And then a clinical scenario question on myasthenia gravis, again integrated with radiology. From what I understand from the students, the patient also had some respiratory distress, and the CT thorax was suggestive of thymoma, right? Another question was, what is the investigation, the PCR investigation that is preferred in a syndromic meningitis? It is multiplex PCR. Okay, multiplex PCR is the answer. Another question was regarding a patient who underwent brainstem tumor excision, who had loss of gag and dysphagia. So I think they had asked regarding what cranial nerves were affected. Again, simple basic question. You know that the cranial nerve 9, 10, they are actually involved in the, the protective reflexes. So obviously the reflexes will be affected. You will be having a bulbar palsy as well. Then as I understand from the students, you can just give me your input in the chat box as well. I understand there was a question on Arnold-Chiari malformation with syringomyelia as well. So that also was asked as an image-based question. So you see that in neurology, whatever questions were asked had a significant overlap with radiology. Okay, whether it be the SAH question, myasthenia question, or the Arnold-Chiari malformation question, right? Okay, right. And I think from rheumatology, as I always stress, vasculitis is always important. And in the topic of vasculitis, I've always stressed the importance of knowing all the manifestations or all the diseases that can present with the pulmonary renal syndrome, right? So patient presenting with hemoptysis, hematuria, with C ANCA positivity, with P ANCA positivity, with ANCA negativity. These 3 points I have stressed. So this time they have asked again of a patient who presented with again hemoptysis And I think the scenario was that of a small vessel vasculitis that was given. If you have got any more inputs, was the ANCA mentioned? Please let me know in the chat box. But from what I understand from the students is that there was no class confusion. The only small vessel vasculitis that was mentioned there was microscopic polyangiitis. Okay, so microscopic polyangiitis is P ANCA positive. Beginners will be C ANCA positive, and when you get a pulmonary renal syndrome with ANCA negative, you will think of Goodpasture syndrome. 3 very important points. Okay, right. Then coming to endocrinology, one question was asked on the stages of diabetes type 1. I think the stage 3 was asked. This again we have discussed in the lecture. I've shown you the image as well on the stages of type 1 diabetes mellitus. This time they have asked regarding stage 3, the symptomatic stage. Then pregnancy, hyperthyroidism, which drug to be given? Again, simple question, propylthiouracil. Then I understand that there was a question on knuckle hyperpigmentation with hypotension, hyponatremia, hyperkalemia. Again, simple question, Addison's disease. Then I think a question on the gene mutation associated with papillary carcinoma thyroid, the BRAF mutation that was asked. Then the next question was, I think from hepatology, a question on Wilson's disease. And again, what students told me is that they had asked about the best investigation. Remember, if you're asked about most sensitive investigation, the answer is increase urinary excretion of copper. But if you're asked regarding the best investigation for Wilson's disease, it is a liver biopsy with estimation of the dry weight of copper. That is what the answer is, Wilson's disease. And again, I suppose there were 2 questions from celiac disease. Again, an integration between medicine and pathology. One question I understand is they had given the histopathological findings, villus atrophy, crypt hyperplasia, and they were asking about which antibody is likely to be positive. Anti-TTG was there in the options. Another patient with, I think the scenario was that of a younger patient who had a failure to thrive, and the doctor had advised a gluten-free diet, and they had asked about the diagnosis. It is again celiac disease. Another question from GIT, post-gastrectomy, which vitamin has to be supplemented? It is B12. See, as I said, a lot of questions of medicine are actually integrated with other subjects as well. Then I think there were 2 questions from ARDS. One question, again, medicine radiology overlap, a scenario of a patient with acute pancreatitis, now having respiratory distress and bilateral opacities in the lung fields. Again, it is ARDS. Obviously, I've mentioned to you that ARDS can be a part of either direct lung injury or indirect lung injury. Pancreatitis producing ARDS is an example of an indirect lung injury producing ARDS. Then they had asked a question of the role of interleukin-8 in ARDS. It's again very important for the recruitment of neutrophils. And remember, interleukin-8, recruitment of neutrophils, and what is the importance of interleukin-5? A very important eosinophil activating cytokine. Okay. Then they had asked regarding pan-acinar emphysema. It is associated with alpha-1 antitrypsin deficiency. Then again, a medicine question integrated with radiology, a combination of bronchiectasis, situs inversus, and sinusitis. Again, Cartagena syndrome was asked. Then again, I think hematology, some questions Vandana ma'am will be discussing, obviously. I think there was a scenario of a patient with multiple myeloma with renal failure. And as I understand, the patient also had features of polyuria and weight loss. So that scenario was that of a multiple myeloma patient. Then again, just let me know in the chat box as well regarding this question. The recall that I got was for a 12-year-old child who presented with cervical lymphadenopathy. And I think, in the image that was given, I think you had a lot of cytoplasmic vacuoles. If that is the case, it is actually a repeat question only. It is Burkitt's lymphoma. Then another clinical scenario of a patient with AML and DIC, and they had asked regarding the mutation, which everybody knows. AML mutation was asked, PML-RARA mutation was asked. Another question which we have discussed in class as well was regarding the subtypes of von Willebrand disease. I have not got the complete recall for this. But again, from what I understand is, there were questions, there were options based on the severity, which type is more severe. So I'll get the full options and then actually let you know the answer. But as of now, I only know that the subtypes of von Willebrand disease were asked.
I have multiple options for that, so I will discuss that.
Okay. So Vandana ma'am will be discussing those questions. One Willebrand disease wala question. Then I think there was a question on an inheritance pattern. So Wiskott-Aldrich is something we have discussed, and the inheritance pattern of an X-linked recessive pattern was actually given. The answer among the options, the X-linked recessive was Wiskott-Aldrich syndrome. Then there was a karyotype question on Turner syndrome. Then I think the bone marrow of Gaucher's disease also was shown. These are the questions that I've got so far from medicine. In the detailed discussion video, I'll be just giving you the images as well. So for the time being, I'm just restricting myself to these questions. And obviously, there are a few more questions, but I think they will be covered by other faculties as well. So let me just move on now to Pallavi ma'am. Pallavi ma'am, can you please discuss the dermatology questions? How were they? In case you have got the session 2 questions also, madam, you can just compare session 1 and session 2 and please take it forward. Thank you so much.
Sir, am I audible? Sir,
yes.
Am I audible?
Yes, you're audible and visible.
Okay. Sir, considering the feedback that I've received for dermatology questions, they were not really very straightforward questions. There were some turns and twists in the language of the questions asked. Although I will say a lot of these questions were previous year topics. I will not say that they were previous year questions repeated. They were previous year topics, I will say. So not much that was asked from outside the syllabus, as I'm always happy to say. Most of it was taught to you in your regular classes, in your videos, in your revision sessions. In fact, the 10 topics that I listed a couple of days prior to the NEET PG exam, I would say 90% of the questions are from those 10 topics, because that is the beauty of short subjects like dermatology. They ask what is the most important. Now, so the language, all the students will agree with me that the language of the questions was a little twisted. The images that were given were a little different from the routine images that you get. But overall, it was not easy. It was also not difficult. So as is the case with most of the subjects, it was a moderate paper. It required you to study the subject properly. This paper could not have been solved by one-liners. So that is the point that I want to emphasize for all the students who are watching this and who are going to give the exam in future. There is no place for rote learning. There is no place for one-liners, for those revision sessions. You have to study the subject, make your concepts, and then revise them further. Please, there are no shortcuts. In fact, this paper gave us the most amount of time to study. So I hope all of you had that much time to study. But no, for the future, no shortcuts is what I will want to say. So coming, just a second, sir. So yeah. So audible, sir? Yes. So
Yes,
starting with the recall, this is a combination of both paper 1 and paper 2 that I have received. I'll be starting with the questions from paper 1. A patient presented with hypoaesthetic skin lesion and histopathology showed granulomas. What of the following is correct? So leprosy of late has been a favorite topic for the INI-CT exam. It has been asked in almost every FMG exam over the last 2 years. So it was a very expected question and a relatively simple one. If a patient is presenting with hypoaesthetic skin lesions, you have to think of leprosy. If the histopath is showing granulomas, means the immunity is good. If the immunity is good, you have to choose between TT leprosy. You don't have to go towards options with LL leprosy. And if the immunity is good, granulomas are being formed, the antigen test, that is the lepromin test, is going to be highly positive. So the correct answer to this question was TT leprosy with antigen test positive. That is the option A, as you see in the screen. The hint was the granuloma that was written for the histopath. Coming to the second question, this is being asked in the NEET PG, in the FMG exam repeatedly over the last 4 years, and it was here in this paper as well. But the language was a little different. The image that is routinely given was not there, and they gave a different image. So it is a previous year topic, not a repeat question. Patient with generalized rash on the body, gray patch on the anal area, and hair findings as shown below. What is the causative organism? In the hair, you can see multiple small scattered patches of alopecia. You cannot really tell whether it is scarring, non-scarring from this image, but you can surely say that there are multiple small, tiny patches of alopecia all over the scalp. A lot of students were confused between Microsporum canis as the cause of tinea capitis looking at this image. They thought that the rash on the body is a fungal infection, gray patch on the anal area is a fungal infection, or they thought rash on the body could be pityriasis versicolor, so Malassezia furfur could be the answer. But it is not a fungal infection. What is the question telling us? There is a rash on the body. It does not say that the rash is itchy. Second thing, gray patch on anal area here refers, you cannot tell reading the question, but when you see the image, you have to think of moth-eaten alopecia that is seen in secondary syphilis. And once you identify that from the image, you understand that the gray patch on the anal area refers to condyloma lata, which is the grayish, moist, flat-topped papules and plaques in the genital area. So the gray word comes from the description of condyloma lata, which makes treponema pallidum as the correct answer to this question. There is a lot of confusion here, but I hope you get it right, that the answer here is secondary syphilis. Therefore, the causative organism is treponema pallidum. Then this question was there in NEET PG 22. This question on nutritional deficiencies and their skin manifestations has been asked in almost every NEET PG exam over the last 5 years. This is a favorite of the FMG paper also. So it was expected. A child with malnutrition and skin lesions, you cannot really say anything after you see this malnutrition and skin lesions, but alleviation of the skin lesion was noted with vitamin supplementation. So vitamin deficiencies in the skin, amongst the options, the correct answer was phrenoderma. I don't have the other options. If you can help with those in the comments, please do. Alleviation of skin lesions on vitamin supplementation takes you to phrenoderma. Direct repeat from the NEET PG 22. But they have also given you a hint with respect to the treatment for the lesions. Now, this is a label the following image, and often ignored part when you read dermatology. You want to skip the first topic, that is the basics of skin. But this question is like brought back from the previous 5-6 years. It was asked a few years back. Now it has come for the first time in these, 5 years. Label the following image. It was like you had to choose the 1, 2, 3, 4 options marked in the image with the correct answer. And these are the 4 things that they had asked. Erector pili muscle, eccrine gland. See, this is the erector pili muscle, which comes from the skin, inserts into the hair shaft. Then this is the eccrine gland, which lies with its isolated opening directly into the skin. Sebaceous gland opens into the hair shaft. Apocrine gland opens into the hair shaft. So the image asked you to mark these following points. A very simple question, I would say, but difficult if you have skipped this. In fact, a question on apocrine glands was asked in the INI-CET November 23 exam also. So they asked which are the glands which are found in axilla and groin. The answer was apocrine gland. So a similar question on the glands and the skin appendages asked in this exam. So you can say that this was a previous year topic from the INI November 23. Now, this is a little tricky question, not asked in the last 5 years, though we read it in all our classes, in all our rapid revision. But as a question, it has been asked for the first time in the last 10 years, maybe I can say. Patient with orange skin, palmoplantar keratoderma, keratotic follicular papules on the hands, and histopathology showing alternating ortho and parakeratosis. So if you combine your knowledge of pathology, it becomes a little easier because the checkerboard pattern you read, where is that seen in pathology? So if you go there, it becomes a little easier. But if you look at the skin, orange, with palmoplantar keratoderma, with keratotic follicular papules, all of this you have read in isolated words, If you read orange colored erythroderma, Pityriasis rubra pilaris will click to you because it is there in all the one-liners. If you go to sandal keratoderma, again, given in all one-liners, keratotic follicular papules on the hands are the nutmeg grater papules, which you find in PRP. Again, it's a one-liner that you read. But all these one-liners combined with their histopath showing the alternating orthoparakeratosis, together it all comes to Pityriasis rubra pilaris as the correct answer. Psoriasis, you can easily rule out because none of these things, psoriasis, most of you have read. So if you have read, it's easier for you to rule out psoriasis. A major confusion was with the word keratosis follicularis because that confuses you with the keratotic follicular papules on the hands. So a lot of students were tempted to mark keratosis follicularis, but it is just another name for Darier's disease, and that has a completely different clinical picture with hyperpigmented warty papules in the seborrheic areas of the body. The histopath shows acantholysis and dyskeratosis. So a completely different clinical picture, completely different histopath, just the name of the disease matches with the findings in the question, which was a confusion. The correct answer to this one is Pityriasis rubra pilaris. In fact, for all of those who are watching, look at the word Pityriasis means scaly, rubra means red, pili means hair. So you see these red scaly papules around the hair, which is what is the meaning of keratotic follicular papules. So the correct answer here is PRP. Then a sexually active patient with painful vesicle smear findings are shown below. What is the causative organism? In the smear finding, what do you see? This cell with a multilobulated nucleus, that is a multinucleate giant cell. A very favorite topic of the INI-CET has been asked twice in the last 4 years. A very favorite of the FMG exam as well. And genital ulcers are anyway a favorite of NEET PG. So this was also a very expected question. When you read the word painful vesicles, you have to start thinking of herpes. When you see the smear finding as multinucleate giant cells, you are doubly sure, making option A, that is herpes simplex virus, the correct answer here. So painful vesicles with MNGs, the answer is herpes simplex virus. This is purely like a pathology-based question. So you can have this in skin, you can have this in pathology. But since the disease here belongs to dermatology, I've put the question here also. So identify the diagnosis. What do you see in the image? You see there is a thickened collagen tissue bundles all over the papillary dermis, extending into the reticular dermis, and even enclosing the eccrine glands and the vascular tissue. So when you see this kind of a pink, all pink, you have to think of fibrosis happening in the biopsy. This fibrosis out of the options, morphia, lichen planus, lichen nitidus, lichen amyloidosis, where do you see fibrosis in the skin? You see that in morphia. So the correct answer to this is option A, morphia. I think the word box-like specimen was also mentioned in the question. Please tell us if that is the correct one. But the answer to this question is morphia. Now we come to questions from paper 2. These are the only questions that I've been able to collect. So let us go through them. Identify the diagnosis. The image was given of DIF. Again, a repeat question from the INICET November 23, an image of the DIF in these immunobullous disorders. So when this image of DIF is given, you see that this is the fishnet pattern. The deposition is within the epidermis. When the deposition is within the epidermis, you have to think of pemphigus. So when you think of pemphigus, you also start thinking of the fishnet. You may have read that somewhere, making it the correct answer here. That is pemphigus vulgaris. Bullous pemphigoid would show linear IgG deposition at the basement membrane zone. Linear IgA, as the name suggests, would be linear IgA deposition at the basement membrane zone, and DH would be granular IgA. Either way, all the other three options would have a line positive only at the basement membrane zone, not this typical fishnet pattern that you see in pemphigus. Then treatment for severe acne vulgaris. I don't know if the image was given for this question, but whenever you think of severe acne vulgaris, it is grade 4 nodulocystic acne that you have to think of. Acne was there in last year's paper also, NEET 2023. And it is there in this paper also. So acne and all the other appendigeal disorders, in fact, are the most important part. So what is the treatment of choice for severe acne vulgaris? This is option B, that is systemic isotretinoin is the treatment of choice for severe acne vulgaris. All the other options, doxyazithrodapsone, are given in patients, but generally grade 2, grade 3. For grade 4, that is the most severe variant, we prefer oral retinoids. This was a tricky question. A child with a patch of alopecia on the scalp with itching. Sibling also has similar lesions. So I have always told you, whenever there is a patch on the skin, a patch of alopecia on the hair with itching, you have to think of tinea capitis, especially if the patient is a child, because tinea capitis happens only in children. Sibling having a similar lesion further takes you towards an infective etiology of the lesion. Now, even if you know this, scraping from the patch shows the following finding. Even you have identified that this is tinea capitis. You look at the options, you see the different fungi in the options. So half your job is done. You have identified this as a case of tinea capitis. But the tricky part comes here, where they have given you a finding of the smear in which you see the arthroconidia within the hair shaft. So when these arthroconidia are present within the hair shaft, what is it? This is the endothrix type of tinea capitis. And I always tell you two mnemonics, GMC, which is gray patch microsporum ectothrix variant, and then the BNT, which is black dot. N is the endothrix here, T is the trichophyton. So when you identify that this is tinea capitis with an endothrix type of infection, you have to think of T, that is trichophyton. So you rule out A, you rule out B. A anyway does not affect the hair. Epidermophyton does not cause hair infections. So that is anyway out. Microsporum is out because that is the gray patch, GMC. It causes ectothrix type of infection. Now you have to choose between Trichophyton violacum and Trichophyton schonloni. See, Trichophyton schonloni is the specific causative organism for Favus. It does not cause any other type of tinea capitis. It is specific for Favus, and in Favus, in the shaft, you see air tunnels. You are not seeing anything of that sort here. Here, you are just seeing a purely endothrix type of infection. So the correct answer here is option C, that is Trichophyton violacum, which is the most common cause of black dot type of tinea capitis, making it the correct answer here. Now, coming to the next question, mycetoma is like I will say mycetoma, because a farmer with a foot swelling and discharging sinus, you have to think of mycetoma. Always they will ask you questions related to mycetoma, where the fungus is causing it. But here they have given you a question that the patient has gram-positive filamentous structures on the gram stain. See, this was a question that I had given in the grand test series before the NEET PG exam on DocTutorials app. This question I had made from my side to apprise you of the fact that it is not necessarily mycetoma that you have to be expecting in the question. Exactly same question is there in the NEET PG grand test on DocTutorials. It is also there in the QBank on the app. From my side, I had made it as a different question from what you normally see with the fungal mycetomas. So when you see that the stain from the lesion shows gram-positive filamentous structures, you have to start thinking of actinomycetoma. And out of these causes here, nocardia, sporotherix, Staphylococcus aureus, aspergillus, which of these causes actinomycetoma? The answer to this is option A, that is Nocardia brasiliensis. For Sporothrix schenki, it causes sporotrichosis, where the farmer would have presented with linear nodules on the lower limb. Then the histopath would have showed you asteroid bodies, special stains would have showed you cigar-shaped yeast. Does not match here. Staph aureus causes botryomycosis. There again, foot swelling, discharging sinuses is present, but the stain would show you gram-positive cocci. In fact, this is a question, again, you can find in the QBank of the bacterial infections on the DocTutorials app. This also was a question that I made because I wanted you to apprise of all the DDs of these mycetomas. So if the answer was Staph aureus, you would have seen gram-positive cocci in the stain. Aspergillus would not cause this. It would be a completely different clinical picture. So the correct answer here is option A. Then patient presents with painful urethral discharge. What is the management? When you see pain with urethral discharge, you have to think of gonorrhea. Further, in the image that was given in the question, you see purulent discharge coming out of the urethra. So painful micturition with purulent discharge, think of gonorrhea. If you think of gonorrhea, you mark the correct answer in the treatment, that is cefixime. Do not mark doxy. Doxy is the treatment for non-gonococcal urethritis. In non-gonococcal urethritis, there wouldn't be so much pain, plus the discharge that you would be seeing would be mucoid, not this kind of a clinical picture. This is a repeat. It has been asked in NEET PG 22. So this question is a repeat that they have given. Lastly, a sexually active woman presented with foul-smelling watery discharge. What is the causative organism? When there is a foul-smelling watery discharge, you have to think of bacterial vaginosis. In bacterial vaginosis, the answer is Gardnerella vaginalis. In fact, bacterial vaginosis, if you look collectively at the NEET PG, the INI-CT, and the FMG exam, collectively every year, at least two of these exams would give you a question on bacterial vaginosis. So that was a very, very, very important topic, and they have done justice to this topic by asking a question. The causative organism for BV is Gardnerella vaginalis. So, sir, with this, I finished the discussion of dermatology questions. I hope you got them correct. I put it in green here to expect a lot of green dots when they assess your dermatology answers. Anything that is different from what has been shown to you? These are just purely recall, that too on the day of the exams. So there may be some discrepancy in the question. There may be some discrepancy in the options. If you notice any of that, please feel free to post it in the comments. I hope your exam went well. Over to you, sir.
Yeah, thank you so much, ma'am, for the session. Can you please unshare the screen? So I hope my screen is visible. Yes. Is it visible, ma'am? Is my screen visible?
Yes, sir.
Okay. So this is just to tell you regarding the live batch that is going to start in August. Just a second. I think it is not in full screen. Okay, I'll just share it later. Okay, so it was just regarding the live batch because I saw a comment in the chat box on when the live batch is going to start. September is when we'll be starting off the online live batch, and the schedule will soon be released. Maybe mostly tomorrow itself, we'll be releasing the schedule, and I'll let you know. Okay, right. Next, I think we'll move on to the pathology recall. Vandana ma'am, can you please discuss the pathology questions of session 1, and in case if you have got session 2 also by this time, please discuss those questions as well. Okay.
Thank you so much, sir. We will just quickly start the recalls.
How many questions, ma'am, in pathology? How many questions?
So basically we have got, can you see my screen by any chance?
No, ma'am, not now.
53 questions, sir.
53. Ma'am, this is paper 1 and paper 2.
Yes.
So how do you see, ma'am, paper 1 versus paper 2, like where they like difficult, was it balanced?
Sir, I'm just going to show you this by one
got a
screen
slide.
which I have.
Okay, sure,
Is I'm visible?
Yeah, you're visible, ma'am. You're visible.
Yes.
Please do share your screen.
Yeah, so there's one, basically this is what I wanted to show. So when we looked at the pathology paper, when we started, basically when everybody started preparing for pathology paper, everybody was super happy. Wow, facts, points, 1 point, short learning, just one things we have to learn. And when the paper came, it was like this. Oh my God, what happened? Oh my God, what is this? Because the paper had images, and images. So there's lots and lots of images. So, and lots of integrated questions also, sir, just like as you said. So basically,
just to interrupt, sorry, ma'am, just to interrupt, your screen is not visible.
Is it okay, sir? Just see why my screen is not visible. Just a second, sir.
Yeah.
Yeah. Is it visible now, sir?
No, ma'am, not now.
No, ma'am.
No, just a second. Is it visible now?
No.
Not yet. Okay. Wait. Now?
No, ma'am. No.
Just a second. Wait. Why is it not loading? I'm surprised. Just a sec. Is it loading now? It's loading. Your screen is loading. It's just a second. No, not loading.
No, ma'am. No, ma'am.
Okay. So let me figure it out. I think then you can maybe.
It shows that you have started screen sharing, but the screen is not showing. So if you could just click on the presentation once more.
Yeah, just a second. I'll do that. Oh, wait.
From the technical team, do you have any suggestions? Any reason why?
Ma'am, can you please reconnect it? Disconnect and reconnect.
Sir, can you see my screen now? Please let me know.
Ma'am, not the screen now. Your video. Yeah, now yes. Now yes.
Yes, ma'am.
Oh yes.
Too much. Yeah. Yeah. Okay. So, sorry guys for the interruption. So when I was saying when we started preparing for pathology, okay, so there were a lot of things going on in the market, lot of people teaching pathology, one liners, one pointers.
Ma'am, you're not audible. Ma'am, you're not audible. Hello, ma'am.
Hi, sir. Is it audible?
Yes, ma'am. Now it's audible. Now it's
It is
audible.
like host disabled participant screen sharing.
Now it's audible. Please make Vandana ma'am the co-host. Please, technical person, please make Vandana ma'am the host. Yeah. Yes, ma'am. I think now you should be able to.
Some issue, I think, from my side only.
No problem. No problem.
Okay.
Now it's audible. Now it's
It
audible.
is like host disabled participant screen sharing. Okay. Yeah, now it's okay, sir?
Yes, ma'am. Now it's okay. Perfect. Yes, ma'am. Now it's okay. Perfect.
So my Zoom is crashing again and again. I think you can give somebody else a chance. Let me shift to other system then.
Okay, ma'am. Please take your time. No problem. No problem. Ma'am.
You
Please
can
take your
give
time. I'll
them
just call
other.
the next person
I'll
and
just yeah.
yeah, no problem, ma'am. No problem. So
Thank
next I
sorry
think we have JP sir. JP sir, can you start the session?
from another system. Bye, sir.
Yes, yes, ma'am.
Hello.
Yeah, JP sir. Yes. Good evening, sir.
Yeah, good
How were the
evening.
forensic questions, sir? How were the forensic questions?
Questions according to me very easy. Hello.
Yes, sir. Yes, sir. You can start the discussion, sir, of forensic questions.
Yeah. 1 minute. Hello, Rahul.
Yes, sir. Yes, sir. You're audible and you're visible. Yeah. Please
And
make it full screen, sir.
screen is also
Please make
shared,
it full
no?
screen. Yes, sir. Please make it full screen.
Okay. Yep. Is all right?
Sir, I cannot see you. Your video is off. Yeah. Yes, sir. Now you're visible.
And my screen recording?
Yes, sir. Now you're visible and please make it full screen, sir. Please make it full screen, sir.
Okay. Is it all right?
Yes, sir. Yes, sir. Now perfect. Perfect.
Okay. Hello, my dear students. I'm very sorry that I joined late because I met with a road traffic accident as usual in forensic medicine. Okay. Let me discuss about 12 questions. I want to go very fast because it is already more than 10 o'clock. Number one, the rigor mortis follows the following sequence. And you know very well, rigor mortis always follow distance law, that is proximo-distal progression. Proximo-distal progression. Rigor group. Sir, first is heart. Heart means center to periphery. That is wrong. First, it is seen in upper eyelid. From upper eyelid, it goes to the neck and jaw. then to the face, then to the chest, then to the upper limbs, then to the thorax, then to the abdomen, then to the lower limbs, and at last, finger to toes. It is known as Newton's law, proximo-distal progression, that is head to feet. That is the answer. Okay. An 18 years old male who was accused of rape is brought for age determination as he alleges that his age is 16 years. The X-ray of joint to be done is. Now, go to the option number A, head and shoulder. We never take X-ray of the head, forget about that. Elbow and ankle around 16 years. If the osseous centers are not fused, less than 16, fused more than 16. But you want to know whether it is less than 18 or more than 18. After number C, elbow and ankle. Elbow, of course, again 16. Okay, I'm sorry. It is supposed to be elbow and hip actually. Okay, it is supposed to be elbow and hip. Elbow 16. Hip 17. Forget about that. Knee and wrist. Of course, always I used to tell that all these osseous varies from book to book. According to Dr. Naran Reddy, knee joint, it fuses around 18 years. Wrist also around 18 years. That means ulna, they say 17 to 19. Then radius around 18. Forget about that. Overall, altogether, knee and wrist, 18. So, if the oscillators are fused, we can say that more than 18. Not fused, we can say less than 18. So, best answer is knee and wrist. Okay. A suspicious stain was examined and the microscopic picture is as given below. Name the test. I was repeatedly telling even my 2020 series, I told you repeatedly that it is a test to identify the semen. Yellow needle-shaped crystals because of spermin picrate. Barberousse test. I also gave one mnemonic BSP. Barberousse spermin picrate. So answer is Barberousse test. Very easy question. Ask repeatedly so many times. Okay. Identify the cause of death by the following image. Of course, what you got the image is not exactly the same image, but here you can see that there is injuries over the inner aspect of the lips. There may be some bleeding or whatever it is. Hanging, there should be ligature mark on the neck. Throttling, again, there should be multiple 6 penny bruises over the neck. Choking, obstruction of the internal air passage. Smothering, where both external respiratory orifices are closed like nose and mouth. Whenever a person lip presses against the teeth and then injury over the inner aspect of the lip, you can see that the answer is smothering. Okay. A man was wearing female clothes with high heel chappals and was not attracted to the same sex. This condition known as a person wearing the clothes of opposite sex. Trans, opposite. Vestism, vest means clothes. Answer is transvestism. Fetichistic transvestism and dual role transvestism, there are two types. In fetichistic transvestism, persons get sexual arousal by wearing the clothes of opposite sex. So here the best answer is fetichistic transvestism. Okay. Trial of an alleged rape case is done. Okay, there is again some mistake. The poison and anti. Okay, I'm sorry. There is some mistake in the typing only. Okay, whenever you do trial in a case of rape, it has to be done in camera. In camera means it is not an open proceeding. It is a closed proceeding where only the required people will be there, like the judge, the staff, the prosecutor, the defense lawyer, the accused, the victim, maybe victim, and the relatives of the victim. So answer is, it is a closed court proceeding. A married woman delivered after 8 months of her husband's demise. The in-laws suspected the daughter-in-law. Later, it was confirmed by DNA profiling that husband is the biological father of the child. The child is known as a posthumous child is a child which is born after the death of either the father or mother or both. So answer is posthumous child. Okay. The presence of one of the following is not required to authorize termination of pregnancy in case of a woman of 27 weeks gestation period with substantial fetal abnormality. MTP Amendment Act 2021 says clearly that after the 24 weeks of gestation, MTP can be performed in case of substantial fetal abnormality, but it has to be authorized by a medical board consisting of a gynecologist, a pediatrician, a sonologist, and any other person authorized by the government. But here the answer is lawyer. Number 9. A 14 years pregnant woman with an alleged issue of sexual assault has come to the obstetrician for termination of pregnancy. In such case, true statement is opinion of one doctor is sufficient. Opinion of one doctor is sufficient up to 20 weeks of gestation. Okay. Okay, here in the question, one point is missed. Her pregnancy was 22 weeks. Okay, 20 weeks. And here urgently I prepared the questions. The question given was 20 weeks. So opinion of one doctor sufficient wrong because one doctor is less than 20 weeks, 20 to 24 weeks, opinion of two doctors. MTP can be done up to 24 weeks of gestation period, yes. In case of rape, means penetrative sexual assault, MTP can be done up to 24 weeks of gestation. MTP can be done only if the life of the mother is in danger. No, that is wrong. It is not only in case of life of the mother in danger. If at all life of the mother is in danger, it can be done at any time. MTP cannot be done. That is also wrong. So here, the answer is MTP can be done up to 24 weeks of gestation period. In this particular case, where a pregnancy period is 22 weeks, I'm sorry again, because urgently I started typing because I met with an accident as I told. Immediately I came and started typing. That is a mistake. So answer is MTP can be done up to 24 weeks of gestation period. Repeatedly I was telling, I have sent the files in all the social media. Okay. A child accidentally consumed an overdose of iron syrup. Which of the following is contraindicated? Already my friend Nilesh Raj must have discussed, this question, maybe pharmacology, maybe forensic medicine, maybe general medicine, whatever it is, you know very well, deferoxamine is a drug of choice in case of iron overdose. At the same time, calcium acetate also can be given, DTP also can be given, but BAL, British anti-leucate, is totally contraindicated. Okay. The police has brought a person from a railway station with a dilated pupil. That itself says road poison. Datura is known as road poison. Datura suppresses the secretion of all the glands, top to bottom. It suppresses the secretion of all the glands. There is dry skin, dry mouth. Because of dry mouth, that is slurred speech. Altered sensorium because it is a delirium poison. Okay, here again there is some problem in the question. I'm again sorry. The answer is Datura. Okay. Again, some mistake has taken, overdose of iron syrup. That has to come there. I told you clearly because I met with an accident. There was some confusion in typing. Okay. The answer is Datura. Okay. Anyway, in detail, I will give a DocTutorial app. You can go through that. A pregnant woman with 4 female children asked the radiologist to tell her the sex of the fetus. In such case, refuse to do ultrasonography. No, you are not supposed to do. Perform ultrasonography. Yes, you have to do. Check for fetal anomalies. Yes, you have to do. And don't inform about the sex of the fetus as. You are not supposed to inform the sex of the fetus. See, I already got the answer. It is B. C, for frontoscopies, check for fit anomalies and inform about the sex of the fetus. You are not supposed to inform about the sex of the fetus. Inform police, no need. No need. No need to inform police according to law. Okay. That is regarding forensic medicine FMT recall session. Again, I say that I'm very, very sorry because the last moment I started typing and there was some mistake because as I told you earlier, I'm into a road traffic accident as of today. Okay. Wish you all the best. Wish you all the best. Bye-bye. Okay.
So thank you so much, sir, for that discussion. And I think, a few minutes before the recall session started, JP sir had put a message in the group that he had met with an accident, but by God's grace, he was all right, but his vehicle had a problem. So, but still, he also wanted to join the session. So he still actually made his way to the session by typing the questions at the last minute. So we'll now go to Rohit Daniel, sir. I think Vandana Puri, madam, is the technical issue corrected, madam?
Yes, sir. I'll just share the screen and see. JP sir, I hope you are okay.
Yeah, I'm perfectly all right, no problem.
Please take care of yourself.
Yeah.
Sir, if you please close your screen, I can share my screen and see if my technical problem is okay.
Okay, I stopped.
Thank you so much, sir. I'll just share and see. Is it okay? So please let me know if you can see my screen.
No, ma'am. As of
No.
now, I can see a video. I can see a video.
Okay. Just a second. Can you see now? No.
No, no.
Just a second. I think now. Can you?
No, ma'am. No.
Why is it happening like this? I don't know. Maybe some GIF I have added.
Ma'am, I think now you're not audible. Now you're not audible, ma'am. I think Vandana ma'am has lost connection. Meanwhile, I think we'll just quickly go to Rohit Daniel, sir. Sir, if you can just discuss the orthopedics question. So, sir, have you got questions of both paper 1 and 2 or paper 1?
No, unfortunately, I only have the questions of the first session as of now.
Okay. Ma'am, Vandana, you just want to, I'll give you a few more chances. Don't worry. Okay, just try, ma'am. Just try whether you can just connect. You're not audible. You're not audible now.
Oh God, I don't know what has happened today. It's so
That's okay,
bad.
ma'am. That's okay. That's okay.
Okay. Only host can share this meeting.
Can you please make Vandana ma'am co-host, technical person, please?
Rohit sir, sorry, but just a second, I'll try. I don't think if it does us.
No problem, ma'am. Take your time. Take your time.
I'm so sorry.
Rohit sir, how many questions from orthopedics?
Just 7 questions.
Okay, were they expected topic areas?
I have to say the questions were from the expected areas, but I think the questions were a little bit tough. I cannot say that the questions themselves are tough, but I think most of the students have gotten used to how orthopedics has been for the last few years.
Okay.
And for the last 2-3 years, the questions have been very, very easy.
Okay.
In the sense that if you had run through just the superficial aspects of orthopedics, you could have got at least 80% of the questions right. But that is not the case right now. The questions have been asked in a very in-depth fashion. So you need both theory as well as a little bit of practical knowledge to answer those.
Okay.
So that was the condition today. So no one-liners and all those things are not going to help you. I think that is a recurrent theme. So I've been listening to all the faculties here, and interestingly, everyone has been saying the same thing. You cannot learn the subject superficially. You will have to go into a little bit depth. I think that's the way to go, because good students, if they have to come up and score good ranks, I think these are the kinds of papers that we want. I think those students who have prepared well, I think they are going to score really good in this exam. So anyway, I have the questions with me. I don't have a PPT. I'll just quickly share the questions.
Yeah.
So
I think, sir, you can just go through the questions. I think.
yeah. So I'll just take 5 minutes. That's all.
Okay.
So first of all, we had an X-ray based question of an intertrochanteric fracture. And the question was, what is the implant used? I think we have all learned this from, if you have listened to my class, intertrochanteric fracture, there are 2 implants that we use, the dynamic hip screw, DHS, and the PFN, proximal femoral nail. This time they had asked the implant DHS, dynamic hip screw. That is the answer there. Okay. The second question was, I think, a clinical question of a fracture of the base of 5th metatarsal was given. And they had said that the patient is being treated with a below knee cast. The question was, how long the cast has to be given? So that is a new question. We never had a question in so much in depth regarding management of a fracture. Here, the correct answer is 6 to 8 weeks. So for most lower limb fractures, the time period of putting a cast is 6 to 8 weeks. Then we had a third question, which was an image of an amputation. So as per the students, there was a image of an amputation. This was a gelatin amputation, which means that the closure was not done, the wound was open, and through the wound, you could clearly see 2 bones, the tibia and the fibula. So the question was, what kind of amputation is this? So if you can see both the tibia and the fibula, this has to be a below knee amputation. I think this is a very logical, straightforward question. I think most of you have got this correct. Then the fourth question was a X-ray based question again of a very, very important topic, a displaced supracondylar fracture of the humerus in a child. The fracture was completely displaced. The question was again a little bit complicated. The question was, what is the classification? What was the classification type? And we have 4 options. The correct option was Gardner classification type 3. I think many students have written it as Salter-Harris classification. That is a generic classification for pediatric fractures involving the physis. The correct classification for supracondylar fractures of the humerus is Gardner classification. Because it is a completely displaced fracture, it is type 3. Then the 5th question, again, a question that many students have gotten wrong is again an X-ray based question. The history was something like this. A man was involved in an RTA and he sustained a back injury. X-ray was taken. There was a fracture line. There was a fracture in the vertebra. The fracture line was crossing horizontally through the vertebral body. It was not your usual compression fracture. It was a fracture running from anterior to posterior. That is your chance fracture or the flexion distraction injury. The correct answer is flexion distraction injury there. Then we have the 6th question. Again, a very, very commonly asked question regarding intervertebral disc prolapse. It was a clinical vignette. The question was something like this. A young man was suffering from back pain with radiation to lower limb. But the question was much more specific this time. I think The question said that there is a specific compression of L4 nerve root, which is the disc prolapse. So I have always taken mentioned in the class that whenever a patient is suffering from IVDP, it is the traversing nerve root or the second nerve root that is involved. If it is L3, L4 disc that prolapses, it is L4 nerve that gets compressed. If L4, L5 disc is prolapsed, then L5, the second one, L5 nerve gets compressed. So here, if the L4 nerve root is compressed, the correct answer would be IVDP L3, L4. Okay. And finally, the most controversial question. The question goes something like this. An 18-year-old boy presented with swelling in the right thigh, and he had clinical features of osteomyelitis or infection-like symptoms like fever, elevated ESR and all those. And X-ray was again interesting. There was a diaphyseal tumor. As per most students, there was a diaphyseal tumor, but with sundry appearance. So this is confusing. Why? Because 18 years and sundry appearance suggests osteosarcoma, but because it is diaphyseal tumor and there are some inflammatory symptoms, then it points towards Ewing sarcoma. So which is the best choice? I would say it is Ewing sarcoma, because even though there is a sundry appearance, because the tumor is diaphyseal and because there is elevated ESR and fever and so on, the correct answer would be Ewing sarcoma. Osteosarcoma, even though is much more common at this age, it's very rare for it to occur in a pure diaphyseal fashion. And again, even in Ewing sarcoma, rarely you can get the sunburst appearance. So the best answer here would be Ewing sarcoma. So those were the 7 questions from the first session that I could get. Anyway, I think the question was a little bit tough, but I think most of the students are very happy, even though the questions were difficult, because it's more of relief than nothing else. So I think you have been very patient. This has been one of the most frustrating exams I think I can ever think of. And you have all done very well, and all the best for your results. Thank you.
Thank you so much, sir. Thank you so much. As you rightly said, many students after the exam, when they were being asked how was the exam, they were saying at least it is over. And that is the good part about it. So I think, Vandana ma'am, can you please connect and see?
Yes, sir. Definitely. Again. Okay. I'll try it again.
Time you're going to succeed, I'm sure.
I don't know. It's like multiple trials of NEET PG
Yeah.
exam. Working? Not working.
Yes, ma'am. Perfectly working, as I said.
Oh my God, I cleared. Okay. Right. Hi, guys. So, starting with pathology, just a point here that whenever we, when we were preparing for NEET PG exam and I used to show so many images, everybody used to say, ma'am, why so many images? Itni images to exam mein aati bhi nahi hai. They are usually one-liner questions in NEET PG. Even in the quizzes, I think Rahul sir will agree with this. Some of the quizzes which I was putting in the group, some students used to message, ma'am, why this question is so tough? Why such immunohistochemistry? You're putting nuclear, cytoplasmic. Why like this, ma'am? So this time the paper proved us actually this was a completely conceptual paper, and I'm sure after the exam you will be feeling like, oh my God, what is the ya khuda kya hua? Itni images. So there were a lot. There was blue, there was pink, there was brown, and there was everything, every other color you can imagine in pathology. Lots and lots of images were there. It was quite a good image-based question and quite a conceptual paper. Yes, there were repeat questions also. I will not deny to that fact, but there were a lot of questions which were from the gray areas, like the first question here. So many of the students said, ma'am, it's like this. So are we ready for the NEET PG? So this is just a recall. And this is shift 1 questions. A lot of questions from hematology, totally 14 to 15 questions from hematology in the NEET PG, both the sessions, and a lot of questions from pathology, and a lot of questions from the gray area. So first question was this, and it was simply as Hertzsprung's disease, and they asked you in which layer the ganglion cells are absent. All of you know it's absent in the in the submucosa and the muscular, right? Mesenous and the Orbach plexus. So the answer to this was 2 and 3. Okay. So this was a question which I had posted one day before the exam. This was a Jinx question. So So TTF positive cells are seen in, and I have posted this just before the exam. This is TTF1 is positive in adenocarcinoma of the lung, and it was the question that came. So answer is adenocarcinoma. So they also gave you a lot of glands were seen. That was another clue, because TTF1 positivity is also seen in small cell carcinoma, but then they are round cells. Okay, so this is easy question. Vitamin 2 is supplemented after gastrectomy. You know, intrinsic factor is released from the stomach if you cut it. So definitely vitamin B12 absorption is going to get affected. And this was an easy question. Okay, coming to next, this was also a easy question, but if you have understood the concepts, and we have discussed this question so many times, apart from the image that was given, the image was not so clear. That is what the feedback was, because many students were confused between DLBCL versus Burkitt. The catch point which I always tell my student is, if you are getting CD10 positive with the immunoglobulin positive and CD20 positive, it has to be Burkitt, because Burkitt is germinal central lymphoma, and surface immunoglobulin positivity will come in Burkitt along with strong CD20 positivity. Why this is not leukemia? Because it is 34 negative and DLT is also negative. So this was Burkitt lymphoma, clear-cut case. Even if the vacuoles were not visible in your image, doesn't matter. IHC was very suggestive. Many students messaged me, ma'am, BCL2 was not given. Please remember, BCL2 is not an immunofluorescent marker. It is not a flow cytometry marker. It can be put on immunohistochemistry. Okay, so that was the answer, Burkitt. Now about von Willebrand disease, which is true. So this was again a very important question. Again, it went deep into hematology. Normally, we study only till von Willebrand disease. Okay, so if we study about this, we all know that von Willebrand disease 1 is most common, but it is not very severe because it is asymptomatic. Von Willebrand 3 is always symptomatic. Okay, because this is the most severe type. So option B was also wrong. Von Willebrand 2 is an abnormality at the receptor level than the quantity level. That's correct. It's a functional defect. And acquired von Willebrand disease is related to myelofibrosis. That's not very correct. Okay, so that is simple. So it was not simple for an undergraduate for sure, because this is what we usually do not study. Undergraduate usually do not study this. So that was the question. So answer is that the functional von Willebrand is type 2. Coming to this question again, this was a tricky question. A lot of students asked me this again and again, and a lot of different recalls also. So this was an 18-year-old male with hepatosplenomegaly. Hemoglobin was 7, and the catch point was lymph nodes were positive. And WBC count is very high, platelet is low. Patient also presents with petechiae purpura. So this is definitely a case of acute leukemia, guys. Many of you marked IVIG. That's wrong. Okay, so how can you give IVIG at this patient? Because he has hepatosplenomegaly. Okay, so you cannot make it as an ITP. Okay. So he has hepatosplenomegaly. The catch point was there were multiple lymph nodes also in this. So that was the important thing. This was a case of adult ALL, guys. Okay, so adult ALL can present with hepatosplenomegaly also. So obviously we follow a protocol called as VAPD. So vincristine and prednisolone were in the option, and that was the answer in this case. Okay, had it been AML case, then you would get cytarabine and doxorubicin. Okay, so that is for AML. IVIG is for ITP. Okay. So answer was very clear to this. This was C, adult ALL. Again, it was not an easy question for an undergraduate, a tricky question. Only if you understand your concepts, you will be able to do this. Please remember, an ITP splenomegaly is not there. Okay, so that was one basic thing. Usually not there. Okay, so this was another question which many students did wrong. Tingling sensation of both the legs with polyuria and weight loss. Guys, this is a very classical image which I always keep teaching my students. Okay, so these are your plasma cells, extensively blue cytoplasm with eccentrically placed nucleus. There are binucleate cells also. So that is also another feature which supports your plasma cells. Okay, so this is a sheet of plasma cells which you are seeing. When you see so much sheet of plasma cells, this is multiple myeloma. He can have polyuria, weight loss, because he's associated with renal failure. Neuropathy is an easily common feature with myeloma which can be seen. Okay, so this was myeloma with renal failure. Okay, next question was cerebellar mass, renal failure, renal tumor with a family history of. So this was a very classical case, and I keep teaching you with mnemonic also. Again, this is not a classical CNS tumor which we study, but we have studied this so many times in the app also, in the Instagram also. This is cerebellar hemangioblastoma and with VHL mutation, and I've told you so many times that this is not a blood vessel tumor. That's what I have always been teaching you. This is a hemangioblastoma. It's a brain tumor. It has a lot of vascularity. That is why it is called hemangioblastoma. It's a brain tumor which occurs in cerebellum, classically with VHL mutation. Okay. In ARDS, what is the role of interleukin 8? This Rahul sir has already discussed. It's a alpha chemokine which recruits neutrophils. Okay. Mutation and papillary carcinoma. This was also a question which I had posted 2 days back in my Instagram. This is basically orphan eye nucleus. That was the image that was given. If you understand this image, you know this is associated with BRAF V60E. And in fact, in the recall session, which I took 1 day before, I told you especially that there is most of these cancers are associated with BRAF V60E, except pilocytic astrocytoma, which is associated with BRAF Kia. So that can be a next question. Okay, Prader-Willi, simple P for P. Prader-Willi is deletion of paternal gene. Angelman is deletion of angel, which is mother. So maternal gene deletion. Gotchas, this was a recall question which I posted yesterday in the group also, that this can come in exam. And this is basically, they asked you very simple question. I expected that they can ask Parkinson's in it because this was a recent update. So recent updation is most important, guys, in today's exam. And the examiners are very, 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 very intelligent, very, very clever. They know that rote learning is not going to work now. Okay. So this was simple. Males are affected and females are a carrier. This can be seen in. So if you know this pedigree, it is only, you can see here males are predominantly affected. So this is a X-linked inheritance, and they gave you the inheritance disorders. They didn't ask you what is inheritance. They gave you the disorders and they asked you kisme X-linked kaun sa hai. So this is Wiskott-Eldridge. Only if you know that Wiskott-Eldridge is a X-linked disorder, you will be able to do this. Otherwise, you will not be able to do this question. So it was not a straight one-liner question. They were making you think, okay, this is X-linked or kaun sa hota hai? X-linked kaun sa hota hai? Batao. So like that they were giving you. So this was a pap smear which I got as a recall from many of the students, and I don't know it was which recall was actual, because everybody sent me different image. So please think about it. If they were given a racenoid nucleus with perinuclear arrow, this is HPV coilocyte. If they gave you this multinucleated cells with multinucleation molding, that is HSP. And if they gave you this, okay, owloid nucleus is a prominent nuclear inclusion. Okay, halo is not very visible in your pap smear, so that is CMV. So I've added all the 3 images because I got equal number of recalls from everybody. So please analyze this question and see what can it be. This was easy question. I am sure all of you answered this, Turners. This was also easy, and we have discussed this so many times. I have given you the compiled chart of the renal tumors, which is also there on my Instagram. It is just charts. You can see there. And the same image is there. So this is your chromophobe. Gross and microscopy was given, and it is chromophobe. And catchy point here is that they typically grow like a plant and have a perinuclear halo. So that is the catch point here. So this is chromophobe RCC. So this was an image question that came. Okay, so there was a complex history in this case. Okay, but the image is very classical. This is neurocysticercosis, and these are the cysts that are given. Okay, so this is very typical neurocysticercosis, gross and microscopy, which came. So this was another image which was not a very classical pathology question, but the only point that we have discussed this earlier in oral lesions also. So remember, like in so acetovite areas are basically seen to identify abnormal areas in cervix. But in cases like vocal cord, how do you identify leukoplakia? So this is a whitish pack, this is leukoplakia. And here you identify AgNO3. You put silver nitrate basically to identify the abnormal area. You take the biopsy and you examine this. So that is what you do. But here another question that I want to tell you is that they can ask you vocal cord polyp also. And most common cause of vocal cord polyp is amyloid. So for that, if it is a polyp, for the next time, for the INICT, I'm telling you, if it's a polyp, you have to think of amyloid and put Congo red in that case. So this again, Rahul sir has also discussed. Okay, so this is an athlete with sudden death. Sudden death athlete has to be HOCM. And I usually tell you a story on this also in my lectures, a true story basically. So here you can see very haphazardly arranged cardiac muscle fibers, and that's very typical for HOCM, which you should remember. And some people told me, ma'am, uske andar kuch pink bhi tha here. So all this pink inside is interstitial fibrosis. So remember, what are the 3 features of HOCM? There is hypertrophy of the cardiac fibers, there is interstitial fibrosis, and haphazard arrangement of the cardiac muscle fibers. Okay. So hypertrophy, haphazard arrangement, and interstitial fibrosis. So these are 3 features of HOCM which we should remember. So boxy biopsy, this Dr. Pallavi also discussed about, and this is morphia. You can see there is loss of dermal appendages. Okay, so that is, and collagenization, extensive collagenization in the dermis. So this is your morphia. This also was a just question, jinx question, which I had added 2 days before the exam, and I told you this, that no blasts or blast equivalents are seen in acute promyelocytic leukemia, and you should always remember the translocation in this case is PML rara, and it's a medical emergency because it presents with DIC. And this was a question that is male child with multiple lesion on the sun exposed area. We already know this is a nucleotide excision repair defect. Again, this was a real case that I had shown. If you've studied from me, the typical patient which has this lesion, so nucleotide excision repair defects usually present like this. PCR for syndromic meningitis, sir has already discussed about it. This is multiplex PCR. Aplastic crisis in thalassemia, which virus will attack the progenitor cell? It has to be parvovirus. So this is again discussed by Rahul sir already. Celiac disease, there is loss of villi. There was an image which was given here. Okay, so you already know there is loss of villi. The flattening here could be seen here. Okay, but however the crypts become longer. So which this was a classical image of celiac disease, and which antibodies will be positive? It is anti-TTG. And again, a child were not improving on antibiotics and they improved with gluten-free diet. Again, it is a celiac disease case which was given. Pan and SNR emphysema. Today morning I had posted this question. This is very typically seen with alpha-1 antitrypsin deficiency, and it's a very easy question. I'm sure all of you would have done this correct. Session 2, coming to session 2, this was session 2. So session 2 was more trickier than the session 1. So let's see. So there was plasma cell 22%, bone plasma cell 22% was seen with bone marrow showing this extra cellular pink material. So what is this? This is very typical amyloid. Mucoid degeneration doesn't look like this. Okay, so this is amyloid which looks like this. Again a hemat question, a very important question. Okay, so this is a question which I have been asking you so many times. It's also on the case series which you can see on my Insta also. Interesting case, but it is difficult for an undergraduate, definitely not a stat question. Okay, so these are acanthocytes which are seen. So they give you the image with these acanthocytes. Patient has neurological manifestation, visual symptoms and diarrhea. This is a very typical case of A-beta lipoproteinemia. Okay, so again, this is a important question and which we have discussed so many times. This is one of my favorite quiz questions which I always give in acanthocytes. So if you have attended my quizzes, you will know this. I keep giving this question again and again. Okay, so this was mass which has KRAS positivity, PTEN mutation was positive, patient was also diabetic and hypertensive, and this was a typical image of endometrioid carcinoma which was given. Again, I'm sure you would have answered this well. Seeing PTEN, you wouldn't have done this wrong. I'm sure all of you would have done this correct. So true about PNH, this also I posted yesterday only as a tentative question. All of you know flow cytometry is the best confirmatory diagnosis. If you would have thought about other things, sucrose lysis test is not a confirmatory test. It is not inherited. PNH is a complementopathy. It's always acquired. And most common cause of death is not anemia and heart failure. Okay. Usually the patients progress into aplastic anemia and die due to infections. So if you look at the bone marrow diaphyseal lesion, so it was basically again a Jinx question which I had posted yesterday. If you have seen my Jinx question, I had posted this Robbins chart, and image was diaphyseal lesion with round cell. This is a very typical image of Ewing's sarcoma. On ortho, they gave you Ewing's sarcoma radiological finding and the case. This was pathology with Ewing's sarcoma histopathology, and they asked you what is the diagnostic mutation in this. 1122, if you have remembered, it is okay, but 2412 also you should have remembered because this is the full mutation that they gave in exam. Okay, so yes, 1122, 24 and 12, that's also a mutation that is given. Some students told me no ma'am, 922 mutation I think, but 922 is 2212 bhi aana chahiye. So so that is why think about what was the recall. If it was 922, then it should also have Q22, Q12. Okay, then it can be said. But otherwise, I think the most common mutation that they gave you was 1122, Q14, Q12. That's the majority of the students gave that recall to me. Okay, so that is the most common mutation with Ewing's sarcoma. Please remember that. This was another question, very tricky question. Only if you know the histopathology, you will be able to answer this. So these bodies, you know, blue color bodies with this very classical appearance, that is this. This is malakoplakia, and all of you know this is Michaelis-Guttman bodies. These are nothing but dystrophic calcification which you see. And I told you these are very, very small calcifications because E. coli gets calcified. So, but the problem with this case was this lesion is usually seen in bladder. They had not given the lesion in bladder. They had given this lesion on the scalp. Okay. So this patient was on mycophenolate and probably he was immunocompromised, and then he started developing these lesions on the scalp. Okay. So this was it. If you could exclude other options, I'm sure you would have been able to mark the other answers well. This was one question which was quite tricky, and definitely you would have, looking at this question of pathology, you would have said, "Ye dukh kahe khatam nahi hote rahe?" So because this was not a classical electrophoretic image, this was an immunofixation image that was given. And if you look at this immunofixation image, basically they had already given a gel electrophoresis has a distinct band that was given. Okay, so whenever we had a distinct band that is given here, they split it into which immunoglobulin it is present with the help of immunofixation. So this is an immunofixation image, and many students are giving different things. So, diffuse bands are basically not very relevant. You have to see a very prominent band, okay, on the heavy chain and on the light chain. So can you see here a very prominent band on G and a prominent band on kappa? So this is G kappa. That is what I got the maximum recall on. Some students said, ma'am, M may be बहुत strong band tha. So I don't think they will give you biclonal myelomas. I think it will be one type only. So whichever is the strongest band, as far as I think it was IgG only with kappa, then this will be the answer, because IgM kappa is little rarer. So again, history has to be important. IgM kappas or IgM bands are more common with Waldenstrom's. Okay, but they have given a clinical history of crab, so that is why I presume that IgG kappa zyada common hoga jo diya hoga exam mein, right? This is again Pallavi has discussed fishnet pattern, and this is pemphigus. It's an easy question, and I'm sure all of you would have done it correct. So write adnexal mass. What are the markers? So this was again a easy question. So right, adnexal mass could be an ovarian tumor. So there will be multiple markers: CA125, LDH, AFP, HCG. All are the markers of the ovarian tumor. So these are probably ovarian tumor markers. 15-3 breast ka hota hai, and this also we discussed in the rapid fire pathology discussion when we did it. So so we discussed this question, and this is A is the correct answer for this. Okay. So this was a stat question again. Everybody was able to identify that this is a RSL, this is Hodgkin's, but they gave you the therapy regimen. So all of you know ABVD regimen is followed by Hodgkin's. So that is why I'm telling you these are not stat questions that came in pathology. Pathology was a lot about images, identify the images, and then identify the diagnosis also. That is how the pathology was running. So this was asbestos body, this was stat question, and I'm sure all of you did this correct. Okay, so these are dumbbell shaped bodies here, these are asbestos bodies. Then there was MI infarction, and I'm sure all of you was able to identify, all of you remember the code which we have made it so many times. So 12 to 24 hours में coagulative necrosis भी होता है, pycnosis भी होता है, neutrophils भी आते हैं, hypereosinophilia भी होता है. So all the findings which you gave me in the recalls fit into 12 to 24 hours, and that was the time of your infarction. Then there was again an hemat question: anemia with TIBC increased and ferritin low and transferrin saturation low and RDW increased. This is classical iron deficiency anemia, and this is one thing which we keep revising again and again. So there was another question on IDA: what happens to transferrin saturation in IDA? Obviously, it is decreased. Transferrin saturation is decreased. TIBC is increased. Okay, so do not confuse this. Okay, there was another question that patient had fever, myalgia. Look at the WBC count, only 3,000. The platelet count are also less, 20,000. Patient also has fever and myalgia. Hemocrit is also low. This is a very classical case of dengue. So whenever there is dengue, what is the most important prognostic factor here? It is always hematocrit, which is the most important prognostic factor here. Okay. Now next question was basically about pheochromocytoma. They gave you a very positive finding that the patient had urine BMA positivity, headache, palpitation. So what is correct? It is meant to. Okay. So that is correct. Other things are not correct. So another question was patient with long arm spectus excavatum, which protein is defective? This was also an easy question. I hope you understood. This is Marfan syndrome and fibrillin is defective, right? This is basically a road. They gave you leukoporia. I don't know if they gave you rosette or not, but this is a very, very classical flexion of intestinal rosette, which will be seen here. And this is a case of retinoblastoma. Deposition in Alzheimer's disease किसकी होती है? So this is basically a myeloid. एक myeloid question तो आता ही है. So this is A beta. This is also easy stat question. This was the image that came in the exam, and this was phyllodes tumors, guys. Okay, so these are leaf-like projections, which you can see. Leafy projections are very characteristic of phyllodes tumor. Again, there was a skid question in which they gave you very tentative thing that ADA levels were low. So there was no doubt in this. Majority of you were able to mark it as skid. So again, there was a question which is not seen with ileal resection. You know, B12 is absorbed in ileum. So definitely microcytic hypochromic anemia will not occur with ileal resection. Everything else can occur. So that is it. Time to take deep breath and relax. Exam is finished. So now you can all relax. So the only thing, I'm sure all of you will get rank. So whatever was stat questions, I think everybody will be able to answer those questions correctly only. But there were a lot of tricky questions also, and I would say pathology had a lot of conceptual questions, lot of new updates, I would say, sir. That is why I think that this time, so if I talk about exam this time, there were a lot of recent updates, sir. Yeah, so there were a lot of recent updates and a lot of image-based questions. And image-based questions were not stat images. It was not the image area. What is it? It was identify the image first and then identify the pathology related to it. So that way, I think it is one of the things which I think is if we have to move forward, we have to move forward with a lot of concepts, lot of updates. And we have to know that we are going to be doctors in future. So we can't work on one line basis. That's not the future. That is not going to happen because nobody's happy about it. That, okay, sort of one line, if you're learning but any subject as a one-liner subject, obviously we are not becoming doctors what we are supposed to become. So I think this type of exam is welcome because this helps you in identifying. This paper reminded me of JIPMER exam, sir, which used to happen earlier. And seeing this exam, I felt, yes, the level is back. The JIPMER level is back. So I was quite happy seeing that level that, yes, it's back. So I still remember whenever people used to prepare for the JIPMER exam, they used to say, ma'am, JIPMER exam is, so this can come, updates can come, this can happen. People used to prepare really hard for it. But that was lost from the past 2 years. And now this paper again reminds me of that. And I think this pattern is going to continue. It's not going to end.
Yeah, I think I completely agree with you, ma'am. I think, at many places, students were stuck between two options because of this type of rote learning. Like, for example, questions in which they were stuck between, is it ITP or leukemia? Is it DLBCL or is it Burkitt's? So only if somebody who has learned the concepts well, they'll be able to answer. Because I've seen, some students writing that, okay, this is ITP, IVIG. So without understanding how to properly analyze that question, because in a question, you will have data. And, even when you are a clinician, you will have to analyze and then come to conclusions. Any subject learned in a one-liner format is not going to help you because in the actual exam, you will face the heat, and that is exactly what Vandana ma'am said. And also one point I just want to tell Vandana ma'am is the effort she actually puts. Many students who have actually benefited by the enormous number of quizzes. I do not know how you find time for this, or do you have a clone for conducting such quizzes? Because I see that on a consistent basis, after that NEET PG postponement, madam was consistently posting quizzes, and there were lots of students who were taking that quiz regularly, who actually found the exam also beneficial because they are used to seeing such questions, images again and again and again and again. So lots of credit for the effort that you have put in, ma'am, for those wonderful series of quizzes, which I'm sure that you will be doing for the subsequent batches as well. And I definitely would recommend everyone, if you're not there in madam's WhatsApp group, please be in that, because you will automatically learn something, every day about pathology. And, that is what you should be there. That group, you must be there. Thank you so much, ma'am, for that recall session.
Thank you so much, sir. Thank you so much. And you have been a source of motivation. I see you as a source of motivation. And you are so wonderful. For the students, I would say that. And I take motivation from you, definitely. And I have also got a lot of backlashing, sir. I will like tell you that also कि मैम इतने टफ क्वेश्चंस आप डाल रहे हो, ये क्वेश्चंस नीट पीजी में थोड़ी आते हैं, ऐसे क्वेश्चन तो एनआईसीटी में आएंगे, आपने ऐसे क्वेश्चन नीट पीजी में डाले कैसे? So seeing this paper, I said, oh my God, now I think the backlashes will decrease.
Yeah, it's very important to have a good range, ma'am. I think when you prepare for such an exam, you're preparing over months for an exam. And if you prepare for just one range of questions, and if the exam question paper surprises you, then you are in for trouble. So this is a strong message for all the students. Thank you so much, ma'am, for joining. And we'll now move on to the biochemistry recall session. We have our own dear Nilesh Chandra sir, who will be discussing the questions on biochemistry. I think sir had made some predictions as well in the groups. He said, do learn about the vitamin deficiencies. There has to be some question from Gaucher's. So I think, pretty much similar questions were asked in the exam as well, sir.
Yes. Good evening, sir, and thank you for letting me join in. Before I quickly mention some of the questions which came, I'll just reiterate what all other faculty have said, that there were very few new topics, very few new topics. But if you had not read the topics and you stuck to one-liners, then you were in a soup. But those who had listened to discussions around the topics or looked at their notes rather than sticking to one-liners, they would have been very happy, at least for the first session, because currently I have most of the questions from the first session only. So I am very sure that the students who took a little bit of time to revise their notes or look at revision points mentioned by the faculty rather than sticking to one-liners, they would be very happy with the paper that came. So what I can do is, let me see, I have some of the topics which are written out with me. Okay. So the biochemistry this time was very integrated and applied, very applied, but none of the topics were new. All the topics which have been asked in last 2 or 3 years, questions were oriented around that only. So let us quickly take a look at some of these questions. One question on Gaucher's, ma'am has already highlighted. You got the image where you were asked about the enzyme deficiency. Just now, Vanda ma'am has talked about that question. Then we had 2 questions from lipoproteinemias. Now, the exact options for these are not clear, but please note they were from the 2 common lipoproteins, which I always say that these are the 2 for which you must know the biochemical aspects, and that is the type 1 and type 2. If the recall given by the students is correct, then these are the 2 conditions which you should be knowing. So the recall that you got is hypertriglyceridemia is there, and which APO defect is there. If that is the question, then you are looking at the type 1. And the second question was talking about the hypercholesterolemia and which defect is there, along with the mention of the coronary artery disease. Then in that case, you're looking at the type 2A. In type 1, basically the metabolism of the triglycerol is slowed down, and in the type 2A, it is the defect in the LDL receptor, which is not able to interact with the ApoB100. So these are the 2 commons. However, some students said, no, sir, for the triglyceride, the question was slightly different. Okay, I've not written it here. So they said, no, sir, it was mentioned that the problem is that there is weakness of the muscle and there is deposition of the triglycerol in the muscle. The deposits of the fat is there. In that case, what is the defect? So if the question was like that, then we are probably looking at the carnitine deficiency if it was there in the option. Some students said it is there, some said it is not there. So once we get all the recall options and we validate it, then I'll be able to tell you the correct question. But in first scenario, when they're asking about APO defect, then we are looking at the C2, ApoC2, which is defective. However, if they're saying that muscle weakness is there and there's deposition of the lipid in the muscle biopsy, in that case, we are probably looking at the carnitine deficiency, so that the fatty acid is not able to enter inside the mitochondria for the metabolism. Then this was a small tricky question. A lot of students got stuck here, where they asked about the action of phenobarbital and what reaction it is inhibiting. So they did not mention the exact electron transport chain like 1, 2, 3, or 4. They had given the reactions. Some of the students, the options that they've given us are the conversion from NADH to coenzyme Q, SDH to iron. So if you know what each of the complexes is doing, only then you can attempt this answer. So whenever we talk about electron transport, we always mention what is happening at complex 1, what is happening at complex 2, what is happening at complex 3. So if you have heard those points, that is how you can answer this question. So this is what is happening at complex 1. This is the reaction which you will see at complex 2. And another problem was that most of our list doesn't have phenobarbital in the list. We are talking about amobarbital, secobarbital in the list. So in complex 1, the sisters or congeners of phenobarbital are inhibitors. So we can extrapolate that phenobarbital will be having the similar action. Now, one of the students also said that there was a graph, sir, for complete inhibition, but I've not been able to verify this. As from the two students I said that one graph was there talking about enzyme inhibition, and it was talking about the competitive inhibition. Now, again, one tricky question which was there, clinical case talking about phenylketonuria. Says that the patient has features of PKU. However, the phenylalanine levels are normal. Features of PKU, but phenylalanine levels are normal. Even if you supplement with phenylalanine, there is no improvement. What is the likely problem? So in this case, you are looking at the coenzyme defects. The tetrahydrobacterin defect can be there. So in tetrahydrobacterin metabolism, there are 4 enzymes which are involved, giving rise to PKU type 2, 3, 4, and 5. Generally, we don't talk about all the enzymes, but the dihydropteridine reductase is one of the important enzymes which you should be knowing. But nevertheless, once we get all the options, we'll be able to pinpoint what is the correct answer. But the question was focusing on the coenzyme, that is the tetrahydrobacterin, which is required for the phenylalanine metabolism. Then this question, I think, has already been mentioned, that a patient presents with hypotonia, there is macroglossia, and the X-ray shows different abnormalities along with the dilated cardiomyopathy. Okay. So dilated cardiomyopathy in a child will indicate towards the Pompey's. Among the given options, Pompey's was the only condition where the dilated cardiomyopathy will be there. We always mention this when you're talking about the glycogen-storage disorder, that the early death in Pompey's is due to the cardiomyopathy. So if you have listened to that comment, then I'm sure that you'll be able to correlate these points, that yes, the dilated cardiomyopathy is due to the Pompey's. Then we had this straightforward question from the Lesch-Nyhan syndrome, which was there. They had given the clinical presentation as told by the students, and you were supposed to tell about the enzyme deficiency. Already Vanda ma'am and Pallavi ma'am has talked about xeroderma pigmentosa, the clinical presentation, and what is the repair defect. So nucleotide exchange repair defect is there in this case. Similarly, again, Pallavi ma'am has talked about the vitamin A deficiency, where the presentation was for phrinoderma, and what vitamin supplementation will improve this. Now, for SCID also, Vanda ma'am has discussed this question, so I'm not going there. I got the B12, Rajiv sir has discussed, Vanda ma'am has discussed that there is ileal dissection, so which vitamin deficiency will be there, or which of the following deficiencies cannot be there. So like that question was there. So in that case, you have to remember that B12 absorption occurs at the ileum only. We got the feedback that we have questions on vitamin B1, straightforward, and pyridoxine, but I've not been able to get the statement of that question. Nevertheless, when we publish the complete recall, then we'll be able to go there. So you see, even in the worst case scenario, when I've not yet got all the questions, 4 questions from vitamins, and this is what I keep telling you, 15-minute revision, and at least 4 questions from vitamins will definitely be there in the whole MBBS. The most highlighted topic is the vitamin section. So don't forget to revise vitamins before you go for the exam. I also told you that majority of the questions will be coming from clinical cases and the inborn errors of metabolism. So you can see most of the questions that we are talking about, are related to the inborn errors of metabolism or the clinical scenarios. So all the questions are from the clinical scenarios, and this is what we had discussed. Sir, most of these questions that I have presented are from the first session. I have not had questions from the second session till now. So this is what I have for you currently, sir.
Yeah. So thank you so much, sir. And I think biochemistry, most of the questions were from expected topics, right, sir?
Yes, definitely.
Expected as well, right? So thank you so much, sir, for joining. And, as faculties, what we would like to tell you is that, yes, if you have given paper 1 or paper 2, we all hope that the exam went well for you. But if it was tough, please take a few days to relax. Let the results come. We'll take the next step accordingly. Because sometimes, I got some messages from students who wrote paper 2, sir, it was very tough. Sir, it was unfair. The paper 1 was relatively easy. But again, see, since there is a normalization process as well,
Yes.
the paper 2 apparently might seem tough for you. What might happen is that your, the actual score that might come out might be actually better. So please don't make preliminary judgments based on the level of toughness of paper alone, especially if you're a good student who has given the second paper as well.
For good students, the paper 2 would translate into a better result. That is definitely there. For the good students, paper 1 would be a tough call because the average students will also be giving a tough competition there. But paper 2 would be very discriminatory, and good students will definitely jump up the ranks when the normalization is done.
So again, as faculties, we would like to tell you that at this moment, please take time to relax a bit because you have been through hell. I'm using the same word because never ever in the history of such an exam that I can even imagine or remember of have the students gone through this much of torture by the exam conducting body. But you have survived all that and you have come so far. So now it's time that you give yourself some time to enjoy your parents, whatever you have not done for the last several months or a year or maybe more than that, please do it. It's time to enjoy. And I think, as we wind up the session today, we are almost at 12 o'clock. I'm sure that many of them will be already having a party at least. So, keep enjoying, have good sleep for a few days. You can sleep now maybe 12 hours, more than that. So now is the time to relax. And again, for the students who have just given the exam as a first timer and you're looking to prepare again, as faculties in DocTutorials, we would be happy to guide and mentor you either through the recorded lectures that we have and the live batch that is going to start, which is a very unique venture, which is going to start in September with a good timetable, as well as via our face-to-face classes in the 3 centers, Hyderabad, Calicut and Trivandrum. We'll be looking forward to seeing and interacting with all dear students. On behalf of all faculties of DocTutorials, we wish that you have got good results. And so stay calm and relaxed and let's wait for the results. And again, hoping that, you will get good results and please let us know as well. We'll be happy to, share your success. And thank you so much and good night, everyone. Thank you so much for joining the session.
Thank you, Rahul sir, for conducting the whole session. Your patience is the guiding spirit for our team. You spend so much time, you dedicate so much effort to pull everyone together, and you're always there for the students. So that is the thing which is taking our team forward. Thank you for being here all the time, sir.
Thank you, sir.
Yes, sir. You are a motivation for all of us.
Thank you. Good night.
Sure. Good night, everyone. Good night, everyone.